Good morning, all from all around the world. We have with us today 650 delegates who registered. Some of them are joining in hubs. We were planning to have a hub in Beirut also. It was not allowed, but you can see the hub in Bahrain. So the Arab Gulf University are joining us in Bahrain as a group. Our chairman, His Excellency, Dr. Adnan Badran, our host, Dr. Fadl Khouri, President of the American University of Beirut, our keynote speaker, Mr. Marco Lambertini, Director General of WWF, the biggest environmental organization in the world, actually, Dr. Khalid Al-Ghouhali, President of the Arabian Gulf University, and his colleagues joining us as a group from Bahrain, speakers and delegates. Welcome to AFED's first virtual conference. It is the 13th actually, and we hope it will lead to concrete recommendations and trigger actual positive changes and action in the health and environment arena. Although the environment has always impacted human health and well-being, the interconnectedness between the two is especially highlighted now with the world in the grip of coronavirus pandemic. Good news today, we start our conference with the first concrete news of a vaccine. Given this context, the topic of the 2020 annual report of AFED, Health and Environment in Arab Countries, is particularly timely and relevant. One key observation of the report is that the pandemic exposed multiple vulnerabilities and shortcomings of the Arab healthcare systems. Producing the report was in itself a challenging endeavor, not only due to the stressful working conditions created by the pandemic, which put limits on normal interaction, but also due to the consequences of the financial collapse in Lebanon on AFED's operations. This was compounded by the Beirut port explosion, which badly affected AFED Secretariat and its partners, damaging our offices and facilities, including many facilities at our host campus, the American University of Beirut. Besides the human and economic tragedy felt by our staff, both at AFED and AUB. Combined with the unsettled situation in the region, this has resulted in a disturbing drop in funding from traditional partners and sponsors, threatening the continued existence of AFED itself. And I am sad to announce this news now. This report is the 13th in the series of the State of Arab Environment. You can see them here, 13 reports which were produced over the past years. They highlighted environmental challenges and recommended solutions and inspired policy changes, knowledge sharing and actions across the Arab region. It has covered many topics, including climate change, water, energy, green economy, ecological footprint, sustainable consumption, financing sustainable development, environmental education, and others. The AFED 2020 report discusses the main environmental drivers that impact various aspects of human health in the Arab region and proposes an action plan leading to the region meeting Sustainable Development Goal 3 health for all. AFED wishes to thank all institutional partners, experts and researchers who contributed to this report, including universities, international organizations, and major players in the environmental health domain. Academic AFED members among universities across the Arab region played key role in developing the report. The core content partners were the American University of Beirut, the Faculty of Health Sciences, which is also hosting our conference. Our control room now is at AUB. And you saw at the beginning some images of the beautiful AUB. We have also researchers from the Arabian Gulf University in Bahrain, Cairo University, and Alexandria University in Egypt. The report also received major contribution from the World Health Organization Regional Center for Environmental Health Action based in Amman. And thank you, Dr. Basil Al-Yusufi, Director of the Center, who is with us today. Special thanks to those few who sponsored the report this year, including mainly the Kuwait Foundation for the Advancement of Science, KEFAS, the Islamic Development Bank, ISDB, and the UN Food and Agricultural Organization, FAO. It is hoped that the report, by highlighting the interrelation between environment and human health, will help to enhance environmental management in Arab countries in such a way to better protect human health and to invigorate the health systems to better respond to the impact of environmental factors. On behalf of the authors and in my role as co-editor of the report, I am pleased to present the main findings of AFED report, Health and the Environment in Arab countries, in bullet points. And those we shall show on screen in Arabic and English. Overview of the report: over 676,000 Arab citizens will lose their lives prematurely in 2020 due to exposure to environmental risks, conventional ones. Diseases mostly driven and impacted by environmental causes in the Arab countries include cardiovascular diseases, diarrheal diseases, respiratory infections, and cancers. The main environmental risks of these diseases, the main environmental risk drivers of these diseases are ambient and household air pollution, lack of access to clean water, marine pollution, uncontrolled urbanization, land degradation, and exposure to waste and harmful chemicals. Water. The COVID-19 pandemic has highlighted the lack of access to safely managed water, sanitation, and hygiene wash services. 50 million Arabs have no access to basic drinking water services, and 74 million people in the region are with no access to basic sanitation services. The poor services of water cause 40,000 premature avoidable deaths annually. Only 9 of the 22 Arab countries are on track to achieve SDG 6 on clean water and sanitation. Wars and refugees increase the stress on the already scarce water resources. Countries should develop and implement water and sanitation programs, commit to financing and advance the enabling conditions that make strong policies, laws, and plans possible. Air. Levels of air pollution exceed the WHO limits by 5 to 10 times. Several Arab cities are among the 20 most polluted cities in the world. Significant rise in number of deaths attributed to indoor and outdoor air pollution, cardiopulmonary disease, cancer incidence, and more cases of asthma. Coronavirus gave an added sense of urgency to enhancing air quality. As studies have shown, evidence of the relationship between air pollution and the increase in and acuteness of cases. Need to improve health risk assessments based on air monitoring and modeling studies, which provide Arab policymakers with the right control tools to reduce the public health impact of air pollution. Solid waste. Solid waste generation has been increasing at an alarming rate in the Arab region due to population growth and changing production and consumption patterns. Health problems attributed to solid waste mismanagement are respiratory disorders, eye infections, and gastrointestinal diseases. 53% of all generated waste indiscriminately disposed of in an unsanitary manner. The COVID-19 pandemic has increased the use of single-use items such as masks and gloves, generating more hazardous waste. Replacing outdated waste facilities with new ones that can reduce associated health risks and halt the dispersion of pollutants. Circular and 3R centric approach, reduce, reuse, recycle, to waste management is critical to reduce the harmful impact of waste on human health and nature. Marine environment. Direct discharge of untreated sewage in coastal zones, offshore oil exploration and extraction, and microplastics have impacted the health of the Arab population. Arab countries produce an estimated 12 billion cubic meters per year of wastewater. Only 60% is treated, half of the treated water is reused only, all the remaining is discharged mainly in the sea. Untreated sewage can lead to the spread of pathogens that cause disease in humans. More research is needed to explore the direct impact of the state of the marine environment on human health in the Arab region, with focus on pathogens, toxin transfer to humans, and antimicrobial resistance. Climate change. Direct impact of climate change include cardiovascular disease, respiratory diseases, heat stroke, injuries, and fatalities. A 1% increase in average temperature is expected to lead to 3% increase in mortality from all causes in the Arab region. Public health issues are generally missing in national climate change adaptation strategies in Arab countries. The region is largely lacking national adaptation plans that address legislative and advisory responses based on projected health risks to heat waves, extreme weather events, air pollution, and infectious diseases. Arab countries need to gain a better understanding of the various factors influencing the impact of climate change on human health in order to design effective mitigation and adaptation strategies. Overall, the experience, the expertise in health and environment related disciplines across the Arab countries is needed. Exchange of expertise is needed, with regional cooperation intensified, encompassing emergency preparedness to face health and environmental diseases. Establishing a primary health care system, including health education, is an urgent task. And here we are in an education institute, a big one, which has with others a big role to play in this field. Ultimately, regional strategies setting common goals to achieve the SDGs are required. The AFED report demonstrates that a healthy environment is a prerequisite to healthy people. So here I tried to give you a general view of the findings of the AFED report. So I had two roles, that's why I was assigned 15 minutes more than others to welcome you and present the main findings of the report. I would like now to welcome Chairman of AFED Board of Trustees, His Excellency Dr. Adnan Badran, who joins us from his office at Petra University in Amman, to welcome us and just give us his view on the matter. Dr. Badran, you are welcome to start. And I say something that we try to mix English and Arabic. In our face-to-face conferences, we have interpretation. Now we try to just fix it in a way to mix and to have some slides to show in other language, because we have people who don't speak Arabic from around the world, while we surveyed that 90% or 95% of those who join can understand English. So, Dr. Badran, choose the language you like.
Thanks, Najib. Thank you very much indeed. Well, I'm going to speak in Arabic language, but will be slides shown to the audience in English. Dear colleagues, زملاء الكرام عن قرب أو عن بعد، كالعادة في شهر نوفمبر من كل عام نحن على موعد مع نجيب صعب، أمين عام المنتدى العربي للتنمية والبيئة، لتقديم التقرير يحضره الجميع لأفد، وهذا العام بعنوان الصحة والبيئة في البلدان العربية. الطبيعة في كوكبنا لها اليد العليا في التوازن البيئي بين مكوناته للحفاظ على نظام بيئي مستدام ومتجدد لهذا الكون. أي خلل يصيبه تلجأ الطبيعة بطبيعتها لمعالجتها جيولوجيا أو بيولوجيا لاستعادة نظمه البيئية والتنوع biodiversity، التنوع البيولوجي فيه. والنظام البيئي للأرض بما فيها من محيطات وبحار وبحيرات وأنهار ويابسة، ومكوناتها من مخزون جيولوجي وبيولوجي يشكل منظومة واحدة مهما تجزأت الجغرافيا والديموغرافيا بحدود سياسية. لذا على العالم التعامل معها ككتلة بشرية واحدة تخصنا جميعا، يظهر فيها الترابط بين البشر والحيوانات والبيئة، مما يستدعي علاقة جديدة وذكية مع الطبيعة. ففقدان التنوع البيولوجي وتلوث الهواء والماء يهدد نظم الإنتاج الزراعي والغذائي الصحي. لقد فرض علينا هذا الوباء جائحة كورونا كوفيد-19 واقعا اقتصاديا واجتماعيا صعبا، نتيجة بصمتنا الشديدة على الطبيعة التي أدت إلى تغيير جذري في انتقال وانتشار الأمراض لتتحول إلى وباء وجائحة كونية وبسرعة مخيفة. وهذا يفرض علينا أيها الإخوة، يفرض علينا التعاون في نهج صحي واحد متكامل للحفاظ على صحة الإنسانية في نظام بيئي مترابط بين النبات والحيوان والإنسان والحياة بمجملها، لبناء قدرات للتعامل مع هذه الأوبئة وتداعياتها والحد من مخاطرها الاقتصادية والاجتماعية. وفي هذا الصدد علينا أن نتذكر التاريخ، تاريخ الأوبئة التي اجتاحت الإنسانية. فالطاعون، الوباء البكتيري الذي اجتاح الإمبراطورية الرومانية ما بين عامي 165 و262 بعد الميلاد، وقضى على ثلث سكان الإمبراطورية، واجتاح مرة أخرى أوروبا عام 1347 وقتل نصف سكانها البالغ آنذاك 80 مليون. وها هو فيروس كورونا 19 يصيب وفقا لمنظمة الصحة العالمية 51 مليون و244 ألف حالة إصابة، ويسبب وفاة 1,269 ألف وفاة في العالم حتى تاريخ 10/11/2020، ويلقي بتداعياته الاقتصادية والاجتماعية، ويسبب إغلاقا شبه كاملا للمدن والمجمعات الإنسانية، مع أن كوكب الأرض استفاد جزئيا بيئيا من ذلك من ارتفاع جودة الهواء والماء وانخفاض انبعاثات ثاني أكسيد الكربون المسؤول عن 72% من ظاهرة الاحتباس الحراري، وانخفاض استهلاك الفحم والوقود الأحفوري، وانطلاق غير مسبوق للطيور والحيوانات البرية. العلاقة بين الصحة والبيئة لا تزال ضعيفة في المنطقة العربية للأسف، مع أنه صدرت الاستراتيجية العربية للصحة والبيئة في إطار عمل للفترة 2017 إلى 2030 في سعيها المتسق لتقليص عبء المرض والعجز والموت المبكر الناجم عن المخاطر البيئية، وكذلك في تنسيق أنشطة جامعة الدول العربية ومنظمة الصحة العالمية وبرنامج الأمم المتحدة للبيئة لدعم هذه الجهود. ومع جائحة فيروس الكورونا جاء تقرير AFED السنوي 13 بعنوان الصحة والبيئة في البلدان العربية في فصوله 7، يبين العلاقة بين الصحة من جهة والمياه والهواء والنفايات وتغير المناخ وتلوث المحيطات من الجهة الأخرى، ضمن أهداف التنمية المستدامة للأمم المتحدة SDGs، الصحة للجميع. وقد أشار وزراء البيئة العرب في اجتماعهم في البحرين في شهر أغسطس من عام 2020 الحالي بدعوة من الإسكوام أن جائحة الكورونا ساهمت في زيادة إنتاج النفايات الطبية والبلاستيكية في المنطقة العربية، وإن الجائحة رغم تأثيراتها الإيجابية على البيئة لكنها مؤقتة، وتبقى التحديات البيئية أولوية عند العودة إلى الحياة الطبيعية، ومع اعتماد الحكومات خططا لتحفيز الاقتصاد، مما يتطلب وضع وتنفيذ سياسة وخطط استراتيجية لإعادة البناء بشكل أفضل، وتنمية اجتماعية واقتصادية أكثر ابتكارا وشمولية ومستدامة بيئيا. ربما أيها الأخوة، ربما هذه فرصتنا في العالم العربي لارتياد الاقتصاد الأخضر لاستعادة ما فقدناه بسبب الجائحة، حيث بلغت كلفتها على البلدان العربية بما لا يقل عن 42 مليار دولار، و1.7 مليون وظيفة وفق التقديرات الأولية. وفي الختام الشكر والتقدير للعاملين في الأمانة العامة AFED على جهودهم المتميزة في إصدار هذا التقرير السنوي حول الصحة والبيئة في البلدان العربية. والشكر والتقدير للباحثين وللمراكز البحثية والمنظمات الدولية والجامعات المشاركة، وعلى الأخص أذكر الجامعة الأمريكية في بيروت لاستضافتها لهذا المؤتمر. والسلام عليكم ورحمة الله وبركاته.
شكرا دكتور بدران. Thank you, Dr. Badran. And now I would like to introduce Dr. Fadl Khouri, the president of the American University of Beirut. We have many doctors around, but Dr. Khouri is medical doctor and a prominent researcher in the medical field. So we are all ears to listen to you, Dr. Khouri.
Thank you. Thank you very much. Thank you, Dr. Badran. Colleagues, friends, it's my pleasure to be with you today and to welcome you to the American University of Beirut. We at AUB are proud to be partnering with AFED to hold this unique and much needed gathering of experts as we face the onslaught of multiple crises that have serious implications for the health and well-being of this region's people and environment. And the report that Dr. Saab just discussed was of great interest for all of us, and having seen it, I would recommend you read the full report that he so nicely summarized. This year, of course, has witnessed dramatic and unprecedented challenges worldwide to public health, food systems, education, people's livelihoods, and their businesses. The development gains seen in many countries over the past several decades could well be erased in 2020. The COVID pandemic is a major driver of these hardships. Many countries were already facing crises before the virus outbreak, Lebanon being a prime example, and these have only been exacerbated by COVID-19. You can hear a polluting plane fly over me as we speak. The 18th century political philosopher and revolutionary activist Thomas Paine, who quit his native England to move to America at the time of their revolution, penned these famous words, which General George Washington read out to his beleaguered troops before they crossed the Delaware River. These are the times that try men's souls. I'm sure that every man and every woman here can relate to that. The economic and social disruption caused by the pandemic has been devastating. According to the World Health Organization, tens of millions of people are at risk for falling into extreme poverty. Nearly half of the world's 3.3 billion global workforce could lose their jobs, while the number of unnourished people could increase to over 800 million by the end of this year. The world's food system is also struggling today as farmers lose access to markets, whether it is to purchase inputs or to sell produce. Agriculture workers who are often self-employed and lack adequate labor protection are facing unemployment and extreme poverty. Those are the people who feed the rest of us. Our environment is also at greater risk, despite the popular notion that the COVID-19 pandemic has been good for the environment. Environmental issues are being given much less priority by governments and leaders due to other crises they are facing. In China this past May, as that country emerged from lockdown and factories looked to make up for lost time, pollution surged to pre-pandemic levels and more than occasionally surpassed them. In Brazil, illegal loggers actually accelerated their deforestation of the Amazon rainforest in the midst of the pandemic, clearing 64% more land in April 2020 compared to the same time in April 2019. As you all know, the list of such environmental disasters could perhaps go on forever. The environment, food security, public health, employment, and labor issues are all interconnected, and all are spiraling downward in Lebanon and in the global south. Now, more than ever, is the time for action and solidarity across borders and societies. So here's where universities can play a major role in hopefully building a better tomorrow or a better new normal. This can be done through research, educational programs, informing public policy, and simply encouraging our youth to learn how to examine the facts so that they can become and do better than we have done. Going back to Thomas Paine, he also gave us these inspiring words written at the outset of the revolution and at the beginning of the great American experiment, an experiment that has seemed particularly at risk during these turbulent times and yet was reinforced by the results of the democratic election that found for a president with far more interest in the environment than his soon-to-be predecessor. Thomas Paine said, "We have the power to begin the world over again." That indeed is what we must now all do together. We need to remake the world to be more inclusive, more sustainable, more fair, more equitable. That is the ultimate goal of this report and so much of what we all endeavor to do. It cannot happen overnight and it will not be easy, but if we persist and give it our all, I am confident that we will prevail. I am personally grateful for the very hard work that has been put into creating this report, and I know the university is proud of Najib Saab and the team of AFED. We all look forward to seeing how it can and will contribute to planning health-related programs throughout the beleaguered Arab region. As educators, scientists, and concerned citizens, it is our duty to do all we can to ensure a better, more sustainable, more inclusive world for our generation and the generations to follow. Thank you very much.
Thank you very much, Dr. Khoury. Dr. Mike Ryan of WHO maybe luckily could not join us today because of his busy schedule, especially today for following Corona, and he is the WHO executive mainly responsible for this matter. So we have with us Dr. Basil Al-Yousfi, the regional director of the WHO Environment Office in Amman. He will talk in the first session. So now we move directly to Mr. Marco Lambertini, Director General of the World Wildlife Fund, WWF. As I said, it's the biggest environmental organization in the world and the most rich also, but it uses all its funds for work more than for administration. And I am a witness to this. Mr. Lambertini will talk about health, COVID-19, and nature. So we are all ears.
Thank you very, very much for the opportunity and the congratulations for yet continuing to hold an event like this despite all the difficulties of the COVID pandemic. It's my pleasure to share some reflections, and I will start sharing actually a short presentation to help me. So you can see the presentation. Very good. So yes, we are definitely living extraordinary times. Before even talking about COVID-19, I want to remind everybody, I know you are familiar with these figures, but I think it's always important to remind ourselves of the seriousness of the impact of our current development model and economic model on the planet, the infrastructure that supports our economy, in fact, as our society. We have already passed the 1 degree of global temperature increase. We're driving more than 1 million species to extinction. We have seen a 2/3 decline of global wildlife population in less than 50 years. We've lost half of the forest, half of the coral reefs, 80% of the wetlands, 90% of the fish stocks in the ocean are either fully fished or overfished, and I could continue. There is no room for complacency. We are at the point where we have to correct our course of development as a society. We're beginning to see also things we've never seen before. Just not even a decade ago, we started to see that even the hottest, warmest water in the tropical regions are getting so hot that corals that has been evolved 250 million years ago are not coping and dying off and bleaching, like in the picture here on the slide. But also we are beginning to understand that science has never been clearer that our impact is not just localized to specific places where we are having an impact. We're actually beginning to affect global systems, from the Atlantic Gulf Stream to the Indian summer monsoon, to large ecosystems like the Amazon or the Antarctic and the Arctic ice sheets, and coral reefs around the world. These are global systems and global ecosystems that are fundamental to maintain the stability of the planet that we have enjoyed in the last 10,000 years, and has been the foundation of our such a rapid human development, particularly in the last 1,000 years. The good news in all this bad news is that today we know the problems, we know, frankly, most of the solutions, but perhaps most importantly, we are beginning to understand some important interdependencies. We've been taking all these issues in isolation, in silos, one by one. We're beginning to understand that actually they are interconnected. And for example, climate change, the loss of nature. There's a lot of attention to climate change, and rightly so, being one of the most important challenges that's facing against society. But we are beginning to realize that actually we're not going to be able to solve climate change if we don't also conserve the natural systems that today sequester a lot of carbon, store a lot of carbon, have the potential to contribute to at least 30% of the mitigation of climate change in the next 2 decades. So the connectivity between climate change and nature loss, it's becoming evident, and we have to treat these two issues as one interdependent challenge. But perhaps more importantly and more excitingly, we're beginning to understand the consequences on us of our impact on nature. This is really something new, because we've been taking nature for granted for so long, and we've been based our development model on an unsustainable use of natural resources. Finally, we're beginning to understand that we are pushing the environmental systems to their limit, and this is beginning to have a direct impact on us, our economy, our society, our well-being, our health. There are many reports now highlighting how the economy is depending so much on the environment. And so nature loss and climate change are actually beginning to be a clear economic risk and cost to our society. And I would invite you to look at this particular last report of the World Economic Forum that makes a strong case for how our economy is so dependent on services and goods that nature provides to us every day for free, from pollination of our crops to fish in the ocean and rivers to coastal protection, stability of the local climate, and so on and so forth. But nature loss and climate change, if they represent a risk and a cost today, they could represent a major economic opportunity. And this is the focus that many are putting on so-called green growth, a growth that continue to offer development opportunity to the region of the world that they need it, but in a way that does not destabilize the climate any longer and does not degrade the environment and lose nature. It is so-called nature positive and climate neutral pathways. And there are plenty of opportunities in a number of sectors to continue in a way that does not destabilize climate and lose nature. To the health issue, what the COVID pandemic has brought into focus is the need to get our relationship with the planet. This is perhaps the most profound and important lesson that we should learn from this tragic crisis. And if you look at the history of the emergence of zoonotic diseases that are jumping from one animal and over the years, and there is actually an increase of the emergence of these diseases over time as well. And the report is adding important voice to a number of the reports, and together make a really compelling case for why, in order to prevent pandemics, we need to look at nature. We need to look at our relationship with nature. COVID-19 is the ultimate indicator of balanced relationship, particularly with natural systems in the animal world, both with animals and domesticated animals. And if you think that 75% is the data from the WHO, 75% of new human infectious diseases come from animals, either wild or domesticated, it makes it immediately clear how critical it is to focus on nature conservation in order to prevent future pandemics. We're all celebrating the discovery of a vaccine, of course, the fundamental step forward now, but we have to invest more attention and more resources in preventing the pandemic, not just hoping for the best and rush to find a next vaccine when thousands, in this case, hundreds of thousands of lives are already lost. And when it comes to our relationship with nature and pandemics, also nature, there are three major areas that have been highlighted very clearly by a number of reports. The first one is the wildlife trade. It's still a huge, most of the time, unknown wildlife trade and consumption around the world that has exposed humans to pathogens in animals for many, many years. Even the HIV virus linked to consumption of wildlife in South Africa, and it was very on a major play for humanity in the last decades. So, curbing wildlife trade and consumption, not only indigenous subsistence consumption, together about industrial trade that is happening around the world is now the fourth illicit trade after arms. Second area is deforestation. This is less direct. But deforestation is a major event and ever exposure of humans to wild animals and therefore pathogens they may host. By increasing access to forests, but also by displacing people, entering contact with villages and nearby. And this is demonstrated for a number of diseases in the past, like the disease in management. And finally, industrial animal farming. This has to do with the wild animals, in fact, about the animals that we domesticate and raise and farm. The concentration of these animals, they puraging very often are perfect conditions for viruses and the potential transmitted to humans as well. And you follow the latest in Denmark, which is
It seems that we were facing technical problem, which is not expected from Switzerland. Dr. Lambertini is talking from Geneva. So
can you hear me?
until we can join again, maybe just we get.
Can you hear me now?
Yeah, I can hear you.
I can continue. I was almost finishing, and I think I'm not sure. You've been able to follow the slides until now?
I can hear you, but I can't. Can you see the image? We cannot see the image.
Can you see the image now?
Yes, you're very good. Yes.
Sorry about that. I don't know what happened. Did you see the slides until now? Did you manage to see my slides?
Yes, we did. Yes.
Yes. Okay.
Just confirming. So I'm almost finished. Apologies about that. I'm not sure what happened. But my point here was that these three main factors, wildlife trade, deforestation, industrial farming, are the ones we need to really focus on and find solution to, because this is the investment that will prevent the next pandemics. And finally, let me jump to a final conclusion. we have two major opportunities in our hands for governments, for business, for society to deal with these issues. One is, of course, the next year, what we call the super year for the environmental sustainability. Many large global agreements on climate, on biodiversity, on the ocean, on food are actually materializing in 2021. And this is the opportunity to look at these agreements and the targets and the investment that this agreement should agree on to really try to tackle the drivers of pandemics like COVID, in particular deforestation and in particular wildlife trade. This is the opportunity to bring the work together with strong commitment to curb deforestation and wildlife trade. And that will be the best insurance for humanity against pandemics in the future. The second opportunity is to use the recovery packages, the investment that will be injected in the economy to recover from the COVID-19 crisis, and use those investments to drive a shift, particularly in the way we produce our food. If you look at deforestation, if you look at wildlife trade, and if you look at animal farming, all is connected to our food system. So focusing on the food system, greening it, reducing its impact, and increasing its sustainability, both social and environmental, is going to be critical. The trillions of dollars that around the world are being injected in the economy could help to speed up, accelerate that transition towards a more sustainable and pandemic risk-free food system. So I will stop here just by saying we have the opportunity as a society now to learn the lesson and learn it quickly, because humans forget quite rapidly. So now is the time to act. Now is the time to take on the lessons from the COVID-19 crisis and embrace a vision for a future which is equitable, carbon neutral, and nature positive. That's the best opportunity we have to create a safe, just future for our children, their children, and all life on Earth. And so I'll finish here. Thank you so much for the opportunity to talk to you about our perspectives on the COVID-19 crisis, health and nature, and congratulations again for the event and for the report. Thank you very much.
Thank you very much, Marco. I mean, I knew you were the best one to talk about this with passion and with information. Now, we didn't have planned for questions and answers for the opening session, but we are lucky that we are efficient. We still have 10 minutes. So I would like to ask the panelists, because the delegates are not connected for this session, to ask questions. Those who are connected are the panelists and the Arabian Gulf University with their hub. So first I would ask, is there any question to Dr. Lambertini from the panel, from the speakers? You can just raise your hand, you know how to use. For the panels, you don't have to raise your hand. You just talk. Dr. Hu, any question to Mr. Lambertini?
No, I enjoyed his talk. I do think that the environmental changes are accelerating, as Dr. Lambertini pointed out, to a greater degree than people realize. And one of the things universities have to do is to teach people to tell the truth, given all the alternate realities that are being put out there by the anti-environmentalists. My question for Marco is, how do you plan to combat this? Because people who gravitate, like our kids and us, to the World Wildlife Fund are people who naturally ignore this and want to shoot anything that they can, legally or illegally. So how do you plan to reach out to a broader audience, including the sort of climate change deniers?
Thank you very much, Dr. Curry. This is a tricky question. Of course, we are doing our best to try to actually move the narrative from the moral duty of conserving nature, which has been effectively the narrative supporting the environmental movement for many, many decades, to the realization that actually nature is fundamental to us. Is not just a moral duty, is actually a survival issue, is an economic issue, is a social issue, is a development issue. In fact, it's an equity and justice issue, because the most vulnerable communities around the world, the poorest of the world, are going to suffer first and more because of nature loss and because of climate change. So I think our attempt to combat what you just said, cultural resistance to this, is to actually connect nature conservation and climate stability to our development, to our well-being. And frankly, COVID-19 has really, unfortunately, helped us with this, because it's creating this direct link between what we do to nature and what could happen to us. So this is the new narrative that I think we are promoting, and is a narrative that is pretty convincing, we hope. And we can see a lot of business leaders, a lot of government leaders really responding very positively now that we realize that actually the ones who pay the price for nature loss, it's not the pandas and the tigers, it's mainly people.
I agree. If I could just make a quick follow-up point, Najib, Dr. Badran, Marco, one of the opportunities that we miss is to introduce this early. So I think by the time they get to college, kids have some formed beliefs, some of which have nothing to do with reality. But I'd love to see this taught in elementary schools and junior high schools. I think this would be a time, we know the period of greatest neurological plasticity is ages almost 3 to just under 7. To start with this into the elementary school, curriculum. Who knows, Najib, given the failure of any kind of healthy nationalism in this region, maybe you could teach them environmentalism.
I mean, I remind you, last year, AFED report was environmental education. Also, AUB was heavily involved. Actually, we introduced the report in November 2019, and we started on the spot visits to many universities in the region, agreeing with them to introduce an introductory course, Environment 101, to just be given to open to every student, whether he is studying history or geography or mathematics or medicine, just to be open to every student, like culture 101, like 101 course. And we reached advanced level in our discussions. The last meeting we had was in March 2020 in Bahrain, and it was the day when they started reporting COVID in Bahrain, and the whole world went upside down. I talk about the first university, whatever. Our report also mentioned exactly what you say, and Dr. Badran is a big proponent of this, that environment and nature should be included in the curricula from first levels. I tell Dr. Lambertini, just personal experience, my grandson, who is 2.5 years old, living near you in Geneva, he just, I mean, when I don't know what an animal is, I show him the photo on Zoom, and he knows all animals what they are. So these things actually start from the beginning. That's why WWF, it's Worldwide Wildlife Fund. Some people think it's only animals.
Right.
But I mean, it's an environmental organization, actually. One of the best reports published about COVID and its relation to its nature origins was produced mainly by WWF.
Thank you.
We have a question. We have a comment here.
Yes, I think Dr. Badran wanted to say something.
Yeah, just really, I have enjoyed the speech.
I moved to Arabian Gulf University, to Bahrain. Dr. Walid Zubari had a comment. So We are listening, Walid.
It is okay. You hear me? Yeah? Okay. Can you hear me?
No, he's.
I guess you hear me.
Yes, you can hear you.
Okay. You talked about the environmental awareness at an early age, but I think what we have also to talk about is the research interface between the environment and the health, which I think in preparing this report, you had a hard problem in getting really evidence-based studies to tell you the impact of environment of the health. And I think this is a call for more cooperation between the College of Medicine and the science colleges. They can join the efforts and try to produce environmental health studies. And I think in the Arab region, I think we have a shortage of that a lot. Even in my university, we are having the medical college with the natural resources and the environment. They are not working together, but I think this is a very good call to start doing this. And I would like to hear from Najib how much difficulties you had in preparing this report as an evidence-based report based on science and actual data, because our experience here in the region, we don't have data on the impact of environment on the health.
Any comment from the speakers?
Yes.
Dr. Lambertini, it seems you have something to say. We can hear you by now.
It's a really powerful point, and he highlights the issue that we mentioned earlier. It's we're dealing with the different disciplines in isolation, and I think we've got to now understand that more integration, more interdisciplinary approaches are required to really connect the dots and find the right solutions that are based on the full understanding of the issues, and particularly when you talk about biology, medicine, and environment. This is where really the interdisciplinary. It's a very, very, very strong, valid point.
Thank you all. It was, to me, it was interesting at least, and I think our participants continued to follow the whole session. One of the advantages of virtual meetings is that they start on time, they finish on time. We cannot play with time because others have to follow. So it's exactly time to finish. It's exactly time for others to start. So thanks a lot for all the speakers. Thanks for making time for this. We are continuing today in 2 sessions, as you know. Tomorrow, 2 sessions, and we shall finish our conference. For the attendees, all the presentations and the texts will be displayed just on time on our websites. And just to know, if you have any friend not registered, because we could not take more, we had 700 registered, you can watch the whole conference for free without registration on AUB and AFED social media outlets. The first session, actually, this was the opening, the first session will be about health challenges of Sustainable Development Goals, SDGs, and their impact on Corona. The session will be moderated by Dr. Iman Nuwayhid. Iman was until recently, and for so many years, the Dean of the Faculty of Health Sciences at AUB. So Iman will moderate the session and he will introduce the speakers. So my role for this hour is done. So I'll have to have fresh air a little bit for COVID. And here I have Dr. Salim Adib telling me, go out. So I'll go out. Thanks a lot.
Okay, good morning, everyone. Good morning from Beirut and the American University of Beirut. So are we ready for the session? Are we ready to start? Hello, Sharbil, are we ready to start? Can you hear me?
Yes, we are ready to start. We have
Okay.
Dr. Bassel Al-Yusfi and Dr. Habib.
Okay.
One thing for the participants who would like to ask a question, please send it to the Q&A coordinator. Okay, so at the end we can gather the questions and send them to the moderator of the session. Thank you.
Okay, thanks, Sharbil. I would like to start. So I'm Iman Waheed, and as Najib mentioned, I'm professor of occupational and public health at the Faculty of Health Sciences here at the American University of Beirut. And I would like to start by really extending my congratulations and special thanks to AFED, specifically to Mr. Najib Saab and his team, and to the Department of Environmental Health at the Faculty of Health Sciences for pulling together an excellent report that responds to a sort of a core issue. I don't want to spend time in the introduction, but this report has focused on the interlinkages between environment and health. And what's really surprising to all of us, and I think our colleague from Bahrain mentioned that this relationship between environment and health is so basic, is so clear. And yet we're all asking, why is it so elusive when we examine policies? Why does it disappear when we're talking about policies? Whatever policies, developmental policies, health policies, environmental policies, we find that link between environment and health is absent. Although the basic concept that this report talks about, that if you have an unhealthy environment, it's only natural that if you have an unhealthy environment, that will impact the health of people as individuals and as community. So that's going to be more or less the focus of this first session. And I'm very, very honored to present two excellent panelists, not only renowned scholars in the region and internationally, but also personal friends and very special and dear to me. So we have two panelists. We have Dr. Bassel Yousefi, who will start in a minute. Dr. Bassel Yousefi is the director of the World Health Organization, WHO Regional Center for Environmental Health Action. This is a position that Dr. Bassel has assumed since August 2009. And before that, he served as the Deputy Regional Director in West Asia at UNEP. He's very well published. So in addition to the many reports he publishes under the center, he has published over 60 peer-reviewed publications, and he served also as associate editor of two major scientific journals. Also on the panel, we have with us Professor Rima Habib. Rima is a professor of environmental and occupational health at the Department of Environmental Health here at the Faculty of Health Sciences at AUB. She also serves as the chair of the department. She is the co-editor with Mr. Saab of this 2020 AFED report. Her research has focused on the living and working environmental conditions of marginalized communities, and she has published over 100 publications, including articles, abstracts in peer-reviewed international scientific journals, book chapters, and reports. So this is my introduction of the two panelists, and I'm sure that we're all looking forward to listen to them. So there's a shift in the agenda, so we're going to start with Dr. Bassel Yousefi and then follow through with Dr. Rima Habib, and then we'll open the floor for questions and discussions. I've asked the two panelists to limit their presentation to less than 15 minutes if they could, so that we're left with 10+ minutes for questions. So Dr. Bassel, it's good to see you. and the floor is yours.
Thank you very, very much. Thank you, Dr. Iman, Dr. Rima, dear colleagues, friends, excellencies. It is a great pleasure to be with you this morning on a great subject, actually. First of all, I would like to start with acknowledging my co-author, Engineer Mazen Malkawi, who is a regional advisor in the World Health Organization. Also would like to mention that for Dr. Mike Ryan, it's not only the COVID-19 pandemic, but also WHO is having its World Health Assembly going on now. It started yesterday, and therefore our governing body is totally in session. So I think this would not reduce the importance of the topic, but actually it is a very busy time for WHO and the world facing this issue. I hope you can see my presentation. I shared it already. Is it uploaded?
Yes, Dr. Basil, if you please make it full screen only.
Okay. I'll start with some principles of the WHO, basically. WHO has been working on issues related to health and environment since its conception 75 years ago. But the center here in the Regional Center for Environmental Health in the region was established in 1985. So basically we were ahead of the game. But our principles are based on issues related that there is no healthy community in a contaminated environment, nor we can have a clean environment in a sick community. So these are interlinkages that are very much important in understanding the subject and building the foundations. 1/4 of the burden of disease in the world, whether it is mortality or morbidity, is due to environmental risks. So this is based on our estimate as WHO. We are lately hit by the COVID-19 pandemic, which is perhaps the largest pandemic that hit the world in the last few decades. But we look at it in WHO as an opportunity for building a resilient, equitable, healthy, and green recovery. So it is a dilemma, but it is an opportunity at the same time. Unfortunately, we need to look at a new way of approaching the environment and health, basically divert from the traditional therapeutic approach of treating diseases and symptoms to improving determinant of health, including the environmental health. So basically the preventive approach rather than the therapeutical approach. From economic perspectives, our estimate as WHO that 10% of the GDP is spent on basically secondary and tertiary treatment, and less than 0.5% is spent on primary care as well as prevention. So the picture is totally skewed. So we need to work together on changing it into the right path. We have in WHO a strategy on health and environment, and it is based on a few pillars. One is scaling up primary prevention, as I have mentioned already. It cannot be done by the health sector alone, or by WHO, or by UNEP, or by the environmental sector. It is a cross-sectoral action, and basically we need to strengthen the health and the environmental sectors in order to lead these issues. We need to build support, basically strengthening the governance of the health and the environment sectors to create demand for healthy environment, including civil societies and NGOs. And we need to build it on evidence and on information, which is unfortunately very much lacking. And if it exists, as have been mentioned earlier, it exists in silos. So basically we have environmental monitoring data, and we have health surveillance data, but these are not interconnected in many cases, and we don't understand the causality that exist on local basis. Also, we've been working with the League of Arab States as well as UNEP in the last few years, and we have developed the Arab Regional Environmental Health Strategy. It was conceived in 2017 to 2030, and it was endorsed by the Arab Summit in the year 2018. It has 9 priorities, environmental health priorities. Let me outline them to you: water, sanitation and hygiene, air pollution and health, food safety, chemical safety, waste management, environmental health emergencies, climate change and health, sustainable development or unsustainable development and health, if I may, and occupational safety and health. These are the 9 priorities that the Arab strategy has tackled. Of course, the environmental causality of diseases is well established and well known for everybody. Actually, let's take the case of indoor air pollution. It can affect heart diseases, strokes, respiratory infection, cancers, chronic obstructional pulmonary diseases, tuberculosis, etc. In general, we can say that about 92 diseases that can be quantifiably linked to environmental risks. So this issue is not only based on the experts' opinion, but the causality is very much quantifiable in terms of health risk impact assessment. This is a very interesting graph, if I may. If we add all these fractions of burden of disease, we'll add it to 100% of fatalities. But for example, let's take stroke. It occupies about 8% of the total death globally, but 3 out of 8%, which is about 45%, is due to environmental fraction. If we look at issues related to diarrheal diseases, for example, about 6% of the fatalities in the world is due to these acute diarrheal diseases, including cholera, etc. But more than half of it, so basically 3.5% of it, 3.5% of the total, which is more than 50% of the diarrheal diseases cause of fatalities, is due to environmental risks and environmental fractions. So this graph shows you really the quantifiable way of introducing the interlinkages between health and burden of disease, environment and burden of disease. The Arab countries are not totally homogeneous. Basically, we had, for the sake of prioritization, to classify them into 3 groups: the well-off, the middle endeavoring countries, and the lacking countries. Unfortunately, due to the emergencies that we are facing in the region, some of the group 2 countries, that these are the middle income countries, have moved into group 3, which are the group that is lacking from socioeconomic point of view, as well as from environmental health services. So the priorities are a bit different from group to group, but anyway, all of them are affected by environmental risks. So for group 1, these are the well-off financially as well as developmental wise. Probably the priorities are focusing on air pollution, exposure to chemicals, occupational health, food safety in terms of chemical hazards. For group 2, actually, we have the double whammy. We have the group 1 and group 3, but for group 3, we still are struggling with water, sanitation, and health. So the basic environmental services are still lacking in these countries. Of course, climate change is a cross-border between all 3 or 4 groups, if I may say. If we are to simplify it a little bit more, we see that communicable diseases are more prevalent in group 3 and group 4 countries. Nonetheless, with the pandemic COVID-19, I think we are facing this outbreak in all countries, and perhaps the well-off countries are suffering a bit more than other countries due to the international travel and interactions. Non-communicable diseases are basically very much prevalent in group 1 and Group 2 countries, basically the well-off as well as the middle-income countries. Injuries are prevalent in all 3 countries, and especially related to traffic. When we look at the picture regarding the mortality attributable to environmental and food safety risk, we see that about 1/4 or 23% of the burden of disease in our region, in the Arab region, is due to environmental risks. Annual premature mortality exceeds 675,000 premature avoidable mortality on annual basis. And the DALI, the last years due to disability and life years, exceeds 25 million yearly. So if we consider that we have about 400 million people in the Arab region, this puts into perspective that perhaps 3 weeks are lost every year from the good, healthy lives of people in the region. Let me mention that 23% is a bit lower than the world 25%, but unfortunately, our people die because of conflicts and wars more than they die from environmental risks. So to put things in perspective, not because we are environmentally better than the other regions, but because we have other problems to deal with. At the same time, let me say, a quarter of the burden of disease is across average, but when it comes to vulnerable groups, as well as children, for example, this number can go as high as 30% of the burden of disease. When we look at the health burden attributable to environmental risks in the region, we see that the major driver is air pollution, exceeds 55-56%. Toxic chemicals about 10%. Occupational health is about 10%. 10% also for water, sanitation, and hygiene services. Foodborne is about 4%, and other environmental issues is about 9 to 10%. Nonetheless, all of these are exacerbated, aggravated by the onset of climate change. So we are basically looking at increasing burden of disease. If we compare the region to the globe, we see that non-communicable diseases attributable to environmental risks are more prevalent than communicable diseases. This indicates that we have more countries that are in the middle class as well as in the well-off classification. Injuries also, we are a bit lower than the world. Having said that, and I talked about the heterogeneity of the Arab countries, let me put it this way: the gradient of the age standardized death in 100,000 population due to environmental risks varies tremendously between the lacking countries and endeavoring countries, as well as the well-off countries. So basically, it varies from about 370 deaths per 100,000 per year to about 50 or 60 per year. So it's going from Somalia into Qatar, and you see it is varying exponentially. And in the middle, basically, we have some kind of plateau that indicates the countries that are in the middle income countries. If we are looking at issues related to air pollution, I think our region is the hardest hit. Basically, the average annual in terms of particulate matter 2.5 micron, we are averaging about 70 microgram per cubic meter. And this is not including the outliers when we have sand and dust storms. We are talking about the annual average. Nonetheless, the recommended number for WHO is about 10 microgram per cubic meter. So this is why we are 7 or 8 times higher than the suggested number by WHO. And let me add to that, 98% of the urban population in the region breathe air that is substandard to the recommendation of WHO. There is a study from Iran that showed that the interrelation between increasing life expectancy and if we meet the WHO particulate matter 2.5 micron guidelines, on average, our citizens will gain about 0.6. So basically, more than half a year in their expected life, just if we lower the particulate matter from 2.5 to 10 micron per cubic meter. Let me qualify this by saying this goes up to more than a year, 0.2 in Egypt and over a year in Saudi Arabia. But we are also in a region that is infamous for naturally occurring sand and dust storm. Nonetheless, WHO has declared in 2013 that all particulate matters that are less than 10 micron are carcinogens, regardless if they are naturally occurring or they are man-made or anthropogenic. So basically, we need to look into this very carefully. And unfortunately, we still have very limited apportionment, chemical apportionment studies to distinguish between the silica and the black carbon. And therefore, our best estimate as WHO that 50% of the particulate matters are man-made. If we look at
Dr. Basil, your time is almost up, so you have less than 1 minute to wrap up, please.
Okay. In terms of water and sanitation, as I mentioned, we still are suffering the variation between the well-off and the struggling countries. Nonetheless, we still have about 25 million, which is a staggering number of people in our region that are still practicing open defecation. 74 million have no access to basic sanitation and 50 million have no access to basic water. In terms of food safety, again, we are struggling. Even for the well-off countries, we do not exceed the 70% capacity.
And Dr. Basil, you need to wrap up. You need to finish.
Yes.
If you
give me half a minute.
Okay.
Okay. In terms of climate change, we are the second most impacted region after Africa, even though our contribution to greenhouse gases is very limited. In terms of occupational health, also we contribute more than a quarter from occupational exposure to cancer prevalence. We look at it from opportunity point of view. WHO is working in the Agenda 2030 of SDGs. Air pollution to be reduced by looking at air pollution by 5% reduction, climate change, climate sensitive disease by 10%, and we are working on reducing the drinking water services for 1 billion. Of course, our region is about 5% of the world, so we can make these calculations. Finally, I would like to leave you with this picture. If you hit at Mother Nature has the opportunity to hit back at us. We wrapped it in plastic, and it is wrapping up now in plastic. So tit for tat. Thank you very much.
Thank you, Dr. Youssef. I apologize for rushing you through the few slides, and we'll just move to the next panelist. So, Professor Habib, you're next, please. If you can, we can stick to the less than 15 minutes. I would appreciate that. Thank you. Rima, you're on.
Okay, I will share my PowerPoint. Please let me know if you can see it.
Yes, we can. Yes, we can go on.
Okay. Good morning to all. Thank you, Iman, for the introduction. And hello, Dr. Basil. Nice to catch up with you. On behalf of my colleagues at the Department of Environmental Health at AUB, I thank the AFED team, and in particular, Mr. Najib Saab, Mr. Sharbel Mahfoud, and Mr. Sada Asad for collaborating with our department in the making of this year's AFED report, Health and Environment in Arab Countries. Despite the countless challenges that our country is going through, and against all odds, AFED and the Department of Environmental Health were determined to have this virtual conference. Our common faith survived the challenges to underline the important linkages between the environment and health, which we hope will be picked up by the states and governments in Arab countries and elsewhere. This is a must for life on Earth to prevail. I also want to thank AUB team without whom this conference would not have been technically possible. Gina Kurdahi, Maya Abu Khuzam, Muhammad Ghandour, and Joseph Azar. Thank you all. Also, I would like to welcome our students at AUB and other universities who have joined the conference today, and I hope that we will be meeting face-to-face soon, observing social distancing. My talk this morning on health as a uniting sustainable development goal in the Arab world is based on Chapter 2 of this year's AFED report. First, I want to acknowledge my two bright students in the Graduate Environmental Health Program at the Faculty of Health Sciences at AUB, Nathalie Haddad, who had a major contribution to this work, and Shelby Surdick from the US, who had come all the way from Alaska 3 years ago to do her Master of Science in Environmental Health here with us at AUB. They are both my co-authors on this chapter. Today, the world is in the midst of a global pandemic. But before I talk about the COVID-19 pandemic and its impacts on the Arab world, let me take you 5 years back to September 2015, when countries of the world adopted the 2030 Agenda for Sustainable Development at the UN General Assembly. The agenda included 17 Sustainable Development Goals referred to as SDGs, guiding global action towards achieving a sustainable future for all by the year 2030. The third Sustainable Development Goal, or SDG 3, aims to ensure healthy lives and promote well-being for all people at all ages. It includes 9 targets on which countries report their progress. These targets relate to a number of outcomes, including the reduction of maternal and child mortality, communicable and non-communicable diseases, and diseases attributed to environmental factors, in addition to achieving universal health coverage, amongst other things. SDG 3 also includes means of implementation, such as increasing financial support for early warnings, risk reduction, and management of national and global health risks. How is the Arab world doing on SDG 3, ensuring health for all, and the health and well-being of its people? The Emirates Diplomatic Academy, in collaboration with the Sustainable Development Solution Network, which is a global network for the United Nations, published the SDG Index and Dashboard report for the Arab world in 2019. This report showed that 14 Arab countries are moderately progressing on SDG 3, and 7 countries are stagnating. Only Oman was on track in maintaining SDG 3 achievements. The data is based on trend years ranging between 2010 and 2018. So it has nothing to do with the current situation. The national averages extracted from the World Health Statistics report published in 2019, more current, showed that the progress on SDG 3 targets vary drastically among Arab countries. Maternal mortality is an example. Although it has decreased over time in most Arab countries, the disparities remain, with a high burden in low-income countries, including Somalia and Yemen, and a much lower burden in oil-rich, high-income countries, including Kuwait, Emirates, and Saudi Arabia. Despite the geographical proximity and the common borders, disparities between countries persist. For example, in Saudi Arabia, under 5 mortality rate is 12 per 1,000 live births, and the mortality rate attributed to unsafe water, sanitation, and hygiene services is 0.1 per 100,000 population. These rates jump to 385 per 1,000 live births and 10.2 per 100,000 population in Yemen. This is an illustration of the impact of poverty on population health. I also have here data from Lebanon and Syria, although the differences are not as pronounced. Aside from poverty, armed conflicts and political instability have a major impact on health and constitute a barrier to progress on the SDG in general, on the SDGs. According to the United Nations, chronic armed conflicts are a major challenge and impede improvements in global health. The Global Health Tracker that I show here on this slide identified 8 Arab countries in armed conflict or political instability. Actually, Yemen, Somalia, and Syria have been ranked as the first, second, and fourth most fragile states in the 2020 Fragile State Index. Displacements resulting from armed conflicts have impacted several countries in the Arab world. According to the UNHCR statistics, 6.7 million Syrian refugees fled to countries including Lebanon, Jordan, Turkey, and others. Lebanon have received alone over 1 million Syrian refugees that were spread throughout all its territories. This has stretched its weak infrastructure and healthcare services. Aside from direct casualties and displacement, armed conflict results in long-term political instability, destruction of healthcare systems, unemployment, and poverty, leading to major consequences on public health. A recent study published in BMC Medicine showed that indirect mortality among civilians increased by 81 per 100,000 population, excluding the direct battle-related death. The resulting outcomes that were most visible included communicable, maternal, neonatal, and nutritional diseases.
Rima, we can't hear you. Something happened?
Okay. I'm getting messages from the control room. Can you see me? The message say that the camera is not correct.
No, we can see you clearly, Dr. Rima. We can see you clearly.
So thank you for that. Apologies. I covered this slide, so I will move to the next one. On top of these health problems, the COVID-19 pandemic emerged at the end of 2019 and was declared by WHO as a pandemic and a global public health emergency on March 11, 2020. Recent history that we can all remember. Like elsewhere, the Arab world was hit by the COVID-19 pandemic. This map shows COVID-19 case fatality ratios as of September 30 of this year, based on the Johns Hopkins University dashboard. The numbers reflect the differences in available resources and testing capacities between countries. Yemen had the highest ratio, followed by Sudan, Egypt, and Syria, while the oil-rich Gulf countries had the lowest ratios. The outbreak uncovered the lack of emergency preparedness, the weak health systems, and the inability to mobilize resources for public health and patient care in most Arab countries, both rich and poor, and I underline that. The strict measures, including social distancing, airport closures, and country lockdowns that were adopted to control the spread of the virus have strained the economy. For example, Saudi Arabia scaled back the Hajj season in July 2020, allowing only 10,000 pilgrims who reside in the country to perform the Hajj rituals. This is compared to 2.5 million pilgrims last year in August 2019. The UN-ESCWA projects a loss of $42 billion and 1.7 million jobs in the Arab countries. We have seen that with Dr. Badran earlier. Businesses had already lost $420 billion of market capital and $11 billion in net oil revenues between January and mid-March 2020. This created a concern for a ripple effect on countries that depend on remittances from oil-rich countries. Lebanon is an example. It is my bias that I live in Lebanon and that I am Lebanese, so I will use this country as a peculiar case study beyond reason. Recently, Lebanon has had multiple crises dealing with political instability, economic collapse, COVID-19 outbreak, and a disastrous blast in Port Beirut. The Beirut port blast resulted from the detonation of around 2,750 tons of improperly stored ammonium nitrate and was referred to by the BBC News as one of the largest non-nuclear explosions in history and the largest in the 21st century. And we talk about the environment. Over 200 people were killed and over 6,500 were injured. The explosion resulted in widespread destruction of dwellings, hospitals, and essential food and medical supplies. In an article published in The Lancet on September 10, 2020, I described with my colleagues the humanitarian crisis in Lebanon following the blast. The currency devaluation, the food price inflation, the poverty rates, the shortage of medicine, and the health personnel emigration escalated. In addition, COVID-19 cases tripled in August following the blast. Social distancing took a backseat as people responded to the emergency. A series of environmental shocks hit Beirut after the blast and its consequent destruction. And I order them in chronological order for you on this slide. A fire erupted in Beirut port on September 10, burning cooking oils and rubber tires that were stored at the site in the port. A dark smoke loomed over Beirut for many hours before it was controlled. And again, on October 22, a tornado hit the port of Beirut, dispersing the hazardous material that remained at the port site following the blast. The health impacts of these environmental health crises on the population of Beirut are yet to be determined. Let us revisit the SDG
just a time alert. You still have 1 minute to go.
Let us revisit the SDG index and dashboard report for the Arab world published in 2019, which I showed you earlier on this presentation. You can tell that the situation has drastically changed, not only for Lebanon that has undergone economic collapse and a series of environmental health catastrophes, but also for the rest of the Arab world that endured the health and economic consequences of COVID-19. What is next? Aside from having to produce a new dashboard and a new report on the SDG progress for the Arab world, dealing with a new era post-COVID-19 pandemic has imposed itself on the Arab world. The COVID-19 pandemic reminded us that infectious diseases do not live within geographical borders. Viruses spread beyond borders, which will eventually be reopened after lockdowns. It is useless to have country-specific health and safety policies in isolation. Policies need to be coordinated across borders. Health for all is a necessity. As the Arabic saying states, إذا جارك بخير أنت بخير, which translates into, if your neighbor is well, then you are well. Finally, I end my talk with a question addressed to all Arab states and governments. Can health unite the countries in the Arab world to reach the SDG targets and protect the health and well-being of its people? Thank you.
Thank you so much, Professor Habib. I think this was a very interesting presentation, and you've asked some challenging questions. Thank you, Dr. Yousfi, because you've also outlined the real challenges that are happening. I'm going to start while waiting for questions to come through from the audience. I'd like to start with you, Dr. Yousfi, and then another question for Dr. Habib. So and I'm going to be very candid, connecting to the comments of Dr. Habib towards the end of their presentation. So you've talked about three groups of Arab countries based on income. You've actually rightfully so spoke about the need to approach it differently, that we need to work together multi-sectorally, we need to build governance, we need to manage our priorities in a better way. But the reality is that there are sharp political divisions within the Arab region, within these groups and across these groups. So in your opinion, and based on your long experience, as the director for a regional center for environmental health action. How can countries in the region transcend their political divisions to collaborate together on managing these environmental challenges? And if possible, it would be great if you can share a successful experience that you've sort of lived through, and maybe a less successful one. Fadlan.
Thank you very much, Dr. Iman. This is a very pointy question, but I'll be as candid as possible. And I'll put my hat as, let me put it this way, as a scientist rather than a representative of WHO. From political point of view, yeah, there are some kind of divisions within our region, and these are opportunities as well as challenges. If we look at the environmental issues that, for example, pollutions cannot stop at the borders, at the political borders. They are transboundary, and basically they will go from one country to another for neighboring countries and for indeed neighboring regions. Therefore, we have no choice but to work together on basically preventing environmental risks. At the same time, I think health can be also a bridge for peacemaking. So basically, when we put them together, health and peace, we can work together on issues related to facing these challenges and these opportunities. At the same time, we have to look in the Arab region at the integrated opportunities. Many of our countries have challenges in terms of wealth. Others have maybe challenges in terms of workforce. Others might be agriculturally rich. Others might be rich in terms of oil and minerals. And therefore, if you look at the region as a region, rather than with the political boundaries and political challenges, I think we have a great opportunity to progress and achieve not only protecting the environment, the ecosystem, the biodiversity, but also human from all kinds of diseases as well as conflicts. Over to you.
Thank you, Dr. Basil, and you provided a segue to my question to Professor Habib. In your chapter, you've sort of touched on it in your presentation. In your chapter, you very interestingly, you actually referred to the SDGs 16 and 17. The SDG 16 talks about peace, justice, and strong institutions. The SDG 17 talks about partnerships. So how optimistic, from looking at the dashboards, looking at all these changes, you beautifully mentioned the unfortunate poverty in some of the countries, the armed conflict, the COVID-19, the overlaying things. How optimistic are you that Arab countries can really achieve the health and environment SDGs in light of the relatively poor performance on SDG 16 and SDG 17? And what can we do as professionals? I know that we're not political figures, but what can we do as environmental, as public health professionals? Rina, you're muted.
Okay. Am I mute? Am I on mute? Okay.
You're fine. You're fine.
Yes. Thank you, Iman, for this question. Yes, you are rightfully right. SDG 16 and 17 are closely linked to SDG 3, health. As I mentioned earlier in my presentation, progress on health requires stability, requires peace, requires building strong institutions. It also requires partnerships and cooperation between organizations, institutions, to reduce inequalities and support vulnerable populations in poorly resourced communities. The need for partnership, as underlined in SDG 17, is essential to provide development assistance, mobilize resources, and increase investment to address the needs in fragile countries, and sometimes in richer countries. Environmental and health professionals, as you have mentioned, what can they do? They need to have a voice. They need to build alliances and networks across the Arab countries. They need to push a health and environment agenda in partnership with advocates, in collaboration with the media that can be a strong advocate, and in linking with like-minded policymakers that can also help and assist in achieving this agenda. This could be a good start. Also, environmental and health professionals have a mandate. Let's not forget that. They need to work for all the population and not just for a selected group of the population. This gives them credibility, trust, and respect. They can use this leverage to rally more people around them and form alliances to work towards a safer environment and better health for all.
Thank you, Rima. I don't see questions here. Let me pull together some key points that the chapters and now the panelists have shared with us. Opening ceremony. Unfortunately, it took a pandemic that's killing millions of people to wake up the globe to the significance of the issue of environment and the fact that if we treat the environment badly, it comes back and bites us. So yet we're still living in a world that's quite unstable, that unfortunately in the midst of this pandemic, in the midst of the economic recession, we still see a lot of disagreements. We still see that the countries and the international organizations are not pulling together to respond to these challenges. We see it also even at country levels. Rima, you mentioned Lebanon as striking a case study where, in spite of all the problems, we can't even form a government. And so how can you really respond to issues like this? And we still look around and see that the region is quickly being split into different political axes and groups. We need, I think, as environmental health people, as people who are involved in the health and livelihood of our communities, to be aware of our surroundings, to be aware of the reality of our situation. And I fully agree with you, Rima, that we need to work together to mobilize and connect across these borders. So I don't see questions there. I know that we've took a few minutes out of the break. So Mr. Saab, Najib, and Charbel, should we stop here because the following session is at I think is at 11. So
Thank you, Iman, very much. Thank you, speakers, for a very interesting session. Now, actually, we are administrating questions, so we told people to keep them for 12 o'clock Beirut time after the second session. So all the questions will be asked then. It is good to keep some time now in between. So we shall start exactly in 9 minutes for the second session, which is on air quality and climate change. So 9 minutes off just to get out for those who are indoor like us, do something, and we start exactly in 9 minutes at 11 Beirut time, 12 Bahrain time, 12 Amman time, or is it like Beirut? Amman is like Beirut, I think, Basil?
Yes.
It's like Beirut.
Yes. Yeah. So just 9 to 8 minutes and we start again. Thanks a lot.
If I may, Mr. Saab, I would like to mention that today there is a meeting in the virtual meeting, that we put it this way, for the League of Arab States to basically tackle the issue related to the progress made on the Arab regional strategy on health and environment. So basically, all efforts are pouring into the same target.
Okay, now you have a break. So we'll all meet at 11 back at.
Thank you.
Thank you, Rima.
Thank you. Thanks, Dr. Iman, Dr.
Good to catch up with you, Dr. Basil.
Always pleasure, always pleasure. And then all colleagues and friends around the region and beyond.
أهلا فيكم مرة ثانية بالجلسة الثانية للمؤتمر اليوم. مثل ما شايف بعد عنا مشاركين من جامعات متعددة، من هيئات حكومية متعددة. مثل ما قلت بالصباح عم نخلط التقديم بين العربي والإنجليزي لأنه عنا مشاركين باللغتين. بالجلسة هيدي معظم المشاركين عربي، فإذا بدكم تحكوا شوي عربي فيكم. بالافتتاح والجلسة الأولى حكينا إنجليزي أكثر لأنه كان عندنا كثير مشاركين من يوروب خاصة ومن دول آسيوية اللي ما بيعرفوا يحكوا عربي. الجلسة الثانية عن نوعية الهواء وتغير المناخ. So our second session in this conference is about climate change and air quality, and the representatives of the authors of the two chapters on air and climate change will present their findings. So I stop here. Dr. Farid Shaban, professor of electrical engineering at AUB and researcher on air quality also, will moderate this session. So the floor is yours, Dr. Farid.
Thank you, Najib. Good morning. First, I would like to start the session by thanking AFED through Mr. Najib Saab, through His Excellency Dr. Badran, Sharbil, and all the team for organizing this conference. Also to thank the AUB team through Dr. Rima Habib for all their efforts. I am glad to welcome on the panel the pronounced experts, Dr. Jihan Hassan from AUC, Dr. Rand Ahmedi from Arabian Gulf University, and Dr. Hassan Daini also from AUB. Before I leave the floor to the speakers, just give me 1 minute to provide a short correlation between COVID-19 and air pollution. Although COVID-19 is the main concern at global scale these days, but let us not forget the mortality numbers associated with air pollution. These are far exceeding the amount of deaths and tragedies from COVID-19. And these numbers are estimated annually at around 7 million people losing their lives due to air pollution or for reasons associated with air pollution. Another correlation between COVID-19 and air pollution, and based on recent reports published in EU and USA and other countries, they stressed that poor air quality make people at greater risk of contracting the virus and suffering serious illnesses and even death. And to give some numbers, a Harvard study recently has found out that a small increase in the concentration of PM 2.5, particulates 2.5, of concentration, an increase of 1 microgram per cubic meter is associated with an 8% increase in the COVID-19 death rate. And these are really alarming figures. So just a final concluding statement, as the world suffers through the respiratory COVID-19 pandemic, the need to breathe clean air has never been more crucial and more apparent. I would like to welcome as our first speaker, Dr. Jihan Hassan. Dr. Hassan is an adjunct professor at the School of Sciences and Engineering at AUC. She advises governments, private sector companies, and NGOs, and is the manager of the Environmental Services Unit at Chemonix Egypt Consulting. Dr. Hassan holds a PhD in environmental engineering from the University of Cambridge. She has over 12 years of professional experience in construction management, environmental engineering, and sustainable development. Dr. Hassan is the author of various specialized publications. Dr. Hassan, you are welcome, and the floor is yours.
Thank you. Good morning, ladies and gentlemen. It's my pleasure to be here with everyone today. I'm going to be discussing the impacts of climate change on human health, Chapter 7 of this year's AFED publication, on behalf of my colleagues as a co-author of the chapter. I will start out with a brief introduction, followed by the global effects of climate change on health, both direct and indirect. I'll touch upon this in the Arab region, and I won't go into too much detail since the following session will be addressing this in more detail by Professor Hamadea. I will talk about current strategies, both adaptation and mitigation strategies globally and in the Arab world, and I'll finalize with some conclusions. I'd like to say that this isn't the first time for AFED to discuss climate change and human health. In 2009, in the AFED annual publication, this was addressed, and this chapter here presents an update for this chapter, and we'll go into a bit more details. It will be remiss of me to discuss this without going back and addressing the Sustainability Development Goals, or SDG 2030 agenda, since both climate change and human health are considered two of the greatest challenges facing the SDGs. And I've heard many refer to them earlier today. I'll talk about SDG 13, which calls for taking urgent action to combat climate change and its impacts, which have both environmental health impacts as well as human health impacts. And we'll go into a bit more detail in that. I'd by discussing the global milestones on climate change and human health. And since 1992, the UN Framework Convention on Climate Change stated that climate change adversely affects human health, and that countries are committed to assess the effect of adaptation and mitigation policies on health. I'd also like to highlight two particular milestones. In 2015, the Paris Agreement at the 21st Conference of the Parties, or COP21, which not only addressed decreasing or keeping global warming potential below 2 degrees, it also addressed the right to health, that it should be central to the actions that countries take. The agreement commits countries to implement adaptation plans to protect human health from the worst impacts of climate change. In 2018, at the COP24, they issued a special report on health and climate change, highlighting the interconnection between the two and presenting an overview of the tools and initiatives that can be used by the international public health, the implementation of the Paris Agreement. As it can be seen, this association between climate change and health is quite intricate, complex, and multifaceted, with many factors involved. These factors are reflected in the literature, and if you like, they've been divided or categorized as both direct and indirect, to have a direct and indirect impacts on health. If you see this figure in front of you, central to the figure in the blue color, you find the direct impacts, which include extreme weather events, rising temperatures, sea level rise, and air quality. Air quality in particular is sometimes considered a direct and sometimes considered an indirect impact. And extreme weather events, for example, can change local communities into environmental refugees. Increasing global average temperature are linked to non-communicable disease morbidities, cardiovascular diseases, and facilitates the formation and dispersion of certain types of air pollutants. If you look at the brown circle surrounding this, this represents the indirect impacts of climate change. And here I'd like to discuss a couple. So let's say, for example, water and food security. In various ways, extreme weather conditions, sea level rise, and increased temperatures lead to reduced crop yields, damaged crop, loss of farmlands and livestock, increasing food prices. Also, warmer oceans and seas lead to reduced yields from fisheries as fish move to higher latitudes for cooler water. Also, social disruption and population displacement often happen as a result of extreme weather events such as wildfires, droughts, floods, which all can lead to loss in farming jobs in general, land, infrastructure, housing, and can cause rising conflicts over scarce resources. Human health is consequently affected due to the reduced access to health service, increasing vulnerability to infectious disease, and increasing mental illnesses. It's very important to note that both direct and indirect impacts of climate change on human health are mediated by other factors such as environmental, geographical, ecological, and social factors. These effects can be short-term, short-lived, or long-term, and often with lifelong consequences for health, such as mental illnesses after extreme weather events, climate-related displacement, and loss of culture. And it's very important for us to be able to understand these factors in order to be able to design efficient and effective strategies to combat this. I won't go into too much detail about these effects in the Arab world because, as I said, they will be discussed in the following session. But the literature indicates that climate change has already imposed a health burden in the Arab region, and that very few Arab countries have identified vulnerable populations like children and the elderly. And it's not currently being given adequate attention by stakeholders and researchers. And there's a huge variability in the information that's being provided by various countries in the region. Now I'd like to talk about the global both adaptation and mitigation strategies, and I'll start by adaptation. Here, the strategies can be categorized based on the climate change health risks, such as the thermal stress, air quality, vector-borne diseases, waterborne diseases, which you can see on the left column. They also can be categorized based on the tools that are used, such as legislative, technical, educational, or cultural and behavioral. So let's take an example. Let's say air quality. In terms of legislative, there are emission controls, traffic restrictions. In terms of technical, we can have improved public transport, catalytic converters in vehicles, or smokestacks for industry. Educational, we'll have pollution warnings, and cultural or behavioral would include carpooling or walking more, using cycling and things of that sort. Now, in the Arab region, there seems to be a lack of adaptation strategies targeting the health sector. However, some countries have implemented local and national health-related adaptation measures. For example, Egypt implemented actions to build institutional and technical capacities to work on climate change and health, and have identified opportunities for further action and climate change adaptation, such as integrated surveillance and response system or building a climate-resilient infrastructure. In Jordan, now Jordan is ranked among the poorest countries in the world in terms of water availability. And so they had a climate change adaptation to protect human health project. And this was aimed to increase adaptive capacity responding to health risks resulting from water scarcity. In Tunisia, they undertook an intersectorial assessment of vulnerability and adaptation to climate change, which resulted in the development of an adaptation strategy. When we talk about mitigation strategies, it's very important to realize that these strategies, unlike adaptation strategies, operate on a more local adaptation strategies operate on a more local and contextualized level and tailored to different objectives, whereas mitigation strategies are often initiated as response to commitments to the UNFCCC and the Paris Agreement through nationally determined contributions, with the sole objective of decreasing greenhouse gas emissions. While adaptation is mostly driven by direct health risks, mitigation measures and policies are driven by economic cost and energy implications. And as a result, here we're presenting general mitigation measures that have been adopted worldwide and their health co-benefits. So if we take an example from the table in front of you, if we look at well-planned urban public transport policies encourage the use of public transport, walking and cycling, these would have the health co-benefits of increased physical activity, reduced obesity, reduced traffic injury and death, reduced noise, and reduced air pollution-related mortality. In the Arab world, almost all Arab countries have signed and ratified the 1992 UNFCCC and its extension treaty, the Kyoto Protocol. And there have been various initiatives in the region. So again, I'll take an example from the table in front of you. If we look at the International Solar Alliance, which mobilizes more than $1 trillion of investment by 2030 for the massive deployment of affordable solar energy, you can see that Algeria, Comoros, Egypt, Mauritania, Oman, Saudi Arabia, Somalia, Sudan, and the United Arab Emirates have taken part in these initiatives. I'd like to very briefly summarize what I've said. So the literature indicates that climate change has already imposed a huge health burden both globally and in the Arab world. When you look at climate change adaptation, there are many global initiatives and programs that are being done. However, in the Arab world, there seems to be a lack of regional adaptation strategies, and in many Arab countries, there's a need for national adaptation plans. With regards to mitigation policies, again, these are driven primarily by economic costs and energy implications. However, the long-term benefit is quite significant. In the Arab world, more needs to be done, especially with regards to policy on climate change mitigation measures. I'd like to say that finally, human health, animal health, and environmental health are all linked, and that human health cannot be protected unless animal health and environmental health are also addressed, which is, I think, been made clear through these presentations and various others. This One Health perspective is very relevant to global challenges such as climate change, since it affects the environment in which humans and animals live. And even though there isn't a direct relationship between climate change and COVID-19, which has also been a topic of conversation today, it is clear that climate change may have an indirect effect on zoonotic diseases in general, which includes COVID in addition to Ebola, bird flu, and swine flu. I'd like to leave you with this quote by the former United Nations Secretary General Ban Ki-moon, who said that climate change is intrinsically linked to public health, food and water security, migration, peace and security. It is a moral issue. It is an issue of social justice, human rights, and fundamental ethics. We have a profound responsibility to the fragile web of life on this earth and to this generation and those that will follow. Thank you very much, and I'm ready for your questions.
Thank you, Dr. Hassan. Thank you for the informative presentation. I guess as Mr. Saab instructed, we will leave all the questions till the end of the session. Thank you. Our next speaker is Dr. Randa Ahmadi. Dr. Ahmadi is a professor and former Vice Dean of Graduate Studies and Research at the College of Medicine and Medical Sciences and professor in the Department of Family and Community Medicine in the Arabian Gulf University in Bahrain. Dr. Ahmadi has over 120 publications in peer-reviewed scientific journals in several fields, notably smoking, non-communicable diseases, and disease burden. She is a member of various regional and global advisory committees and has worked on the Bahrain National Communication on Climate Change. Dr. Ahmadi is the commissioner of the Lancet Neurology Journal to study strokes in low and middle income countries. Dr. Ahmadi, you are welcome. The floor is yours.
Thank you very much for the introduction, Dr. Farid. I would like to start by thanking Dr. Najib for bringing me on board with all of you when he came to Bahrain just before COVID-19 started, and he convinced me to join the group. It is really it is a pleasure for me to be with the group for many reasons. First, I'm also with my AUB Faculty of Health Sciences, where I graduated from, people and family. And I'm seeing others who have been, I haven't seen, at least virtually. The other thing is I'm very thankful to the opportunity to have worked with the group on the chapter. And it is really one of the unique times where everything was so smooth and we were very, so all the co-authors were great. And we were very, I think we were, we don't know, I don't know any of them, but now we know each other. Back to what I want to talk about is I did not prepare slides because Dr. Jihan has already given a very comprehensive outline of the chapter, but I want to just comment on certain things which are relevant to the Arab region. We know, first, Dr. Jihan, you did a great job even representing my part, which is summarizing it. Now, we know that the Eastern Mediterranean region is reported to be the second region which is vulnerable to heat exposure after Europe. And extreme weather and climate action failure are ranked among the 5 risks by likelihood and impact globally. However, our countries did not, the respondents of the global risks survey did not, risk perception survey did not rate them among the 5. So there is this understanding that an underestimation of the problem. The region faces several challenges to climate change with respect to morbidity and mortality, and of course, DALIs have not been touched upon in several literatures which I have encountered. I want to also comment on the data sources that I have used in writing the part of the chapter. I found that the first one that I looked at it is the United Nations Framework Convention on Climate. And to my surprise, I found only few national communications submitted have included health. And those that have included health, there is variation in the amount of, or the capacity that they have allowed to include about health in the report. The projections also were much fewer when we talk about what are the projections. We have Egypt, Jordan, Lebanon, Morocco, Oman, and some other countries have included these projections. Now, if you go to that website, you find that some countries are still at the cycle 1, which they have submitted, like Iraq has, in 2015, has submitted the first report, while Jordan has submitted report 3 in 2014, and Bahrain has submitted the third cycle in 2020. So there is really a great variation in that. With respect to the publications that this study the association between climate change and health, it is really, I felt a bit sad that there aren't many papers that look into the Arab region, several countries together, except for a paper which was written by Professor Habib and another by Dr. Khader, and of course the AFED report in 2009, which is a book. There is variation in the countries with respect to the research output of climate change and health publications. And there is lack of studies in several countries that you hardly can find anything to write about. Now, coming to the literature, of course, Dr. Jihan has mentioned that there are direct effects and indirect effects. And here the most direct effects that hit the region are temperature, heat waves, sandstorms, droughts, and flooding. Looking at the mortality, all causes mortality from all causes, we find that few studies have examined the association of climate change and mortality, and they have indicated that rises in temperature are associated with more increased premature mortality. And these studies came from Egypt, Tunisia, UAE, and Lebanon. However, in Bahrain, an ecological study has been done and showed that humidity was the one that was associated with, temperature was negatively associated. Now, the region faces a lot of flooding and rain and heavy rain, and there are a lot of fatalities due to that. So some countries in the region have experienced flooding in the last decade, and there's so many out of the Arab countries have faced that. In the region, Saudi Arabia continuously faces that, particularly Jeddah. No, so fatalities due to heavy rains and flooding, and then we have fatalities due to dust storms and low visibility. So there are these are several, one study from Kuwait, we don't have many studies, we don't have any studies, showed that when fatalities, when there are storms, when we have a lot of sandstorms and low visibility cause higher fatalities. Now, there is also literature on mortality from specific causes, mainly CVDs, asthma, and other respiratory diseases, non-accidental injuries, RTAs, and dengue fever. Now, you can find just little from here and there to write about, but sometimes you have only 1 or 2 countries to represent. It makes it is difficult. About RTAs, not many are writing about RTAs, and humidity, for example, in the study that has been conducted in Bahrain, it was positively correlated with humidity, the RTAs in Bahrain. Now, with respect to morbidity, morbidity, the Arab region is a hotspot for emerging and re-emerging communicable diseases, and climate change is one of these contributors. It increases waterborne diseases, foodborne diseases, vector-borne diseases in our region. So some of the diseases that have been listed or as related to climate change, cholera and waterborne diseases, we had outbreaks of cholera that have been during the last decade in Somalia, Iraq, and Yemen, and they were associated with high temperature. We have foodborne diseases. We know that the GCC countries have high temperatures in the summer, and there is a risk. There were reports of outbreaks. Particularly, there was one from Dubai and Kingdom of Saudi Arabia, and we know that also in Bahrain we have about 6.9% or about 7% of the notifiable diseases were associated with humidity from foodborne diseases. The vector-borne diseases, malaria is endemic in our region, in Djibouti, Somalia, Sudan, Yemen, and however there are increases in cases that have been attributed to heavy rain and temperature and relative humidity. Now, there are scanty reports about tuberculosis and scabies from Morocco and Algeria. Going to non-communicable diseases, temperature has been shown to be affecting cardiovascular disease visits, in increasing the cardiovascular disease visits in the UAE. And in Bahrain, it has been shown that hospital discharges were associated with humidity for CVDs. Ischemic heart disease, again, there is a report from Syria that it is related to temperature. Bahrain, it is also related to humidity. Most of the data from Bahrain show the humidity as a factor. Now, Kuwait has shown that dust and sandstorms have affected the admissions in Kuwait and of COPD and asthma. And the literature is not rich enough for, we have just little few papers that are mentioning dust and sandstorms. And I felt really very sad that we are an area that has dust and sandstorms. And I know we had so many appeals for doing studies on dust and sandstorms, and yet we don't have, and health, and we don't have, this is really a weakness in our research. Heat cramps and dehydration, also increase in temperature. Kuwait and the UAE have shown that there is an association with temperature, while UAE with humidity. Again, morbidity, RTAs in Bahrain were associated, an ecological study showed that it is associated with humidity and mental illness as well. And we know also there is drought in some countries of the region, like in African countries like Djibouti, Mauritania, Somalia, and South Sudan and the Sudan in the last decade, and have affected undernutrition and food insecurity. Coming to vulnerable population, our region, particularly the Gulf, we have the construction workers are at higher risk. Definitely those who are outdoor are at higher risk, but we are at higher risk because of the temperatures that we encounter in the summer. So there were some studies in Bahrain that looked into that, and the UAE. So we have construction workers and outdoor workers, we have children, and these children, a study from the UAE showed that children in the summer months, school children have more migraines and asthma admissions during standard storms in Kuwait among children, and diarrheal diseases in the summer. So, and the last group is the elderly. Not much has been done on the elderly in our region. And I mean, with respect to what we're talking about. Now, projections. We have very few countries, not all the countries, have made their projections, and in the chapter you will find the projections. But in general, we know that malaria is going to increase, particularly in Sudan, Oman, and Morocco, and leishmaniasis, waterborne diseases, and there will be re-emergence of some diseases like malaria in Tunisia, and schistosomiasis in Tunisia as well. There will be an increase in NCDs, increase in allergic and pulmonary diseases due to increase in sandstorms. The overall mortality or all causes mortality would increase, CVDs, strokes, respiratory diseases, infectious diseases, and fatalities from flooding and droughts. So mortality it is speculated also that mortality among the elderly from heat leading to strokes and heart attacks would also increase, and fatalities due to flooding and drought. I'd like to conclude by saying that the impact of climate change on health is not given adequate attention. That's the least to say by stakeholders and researchers in the region. There is really an urgent need to address the knowledge gaps and have support from health policymakers. There is a lot of need to ask researchers to collaborate across the Arab world to do multi-center studies and to إثراء publications in the region. Thank you very much.
Thank you, Dr. Hamadi. Your timing and the timing of Dr. Jihan are really perfect. Just in time. Thank you. Our next speaker is Dr. Hassan Dhaini. Dr. Dhaini is an expert in toxicology and health risk assessment with more than 18 years of experience. He has served as a consultant for local authorities, private firms, and international agencies, and is currently an assistant professor at AUB. He holds a PhD in toxicology from University of Michigan, Ann Arbor. Dr. Dhaini, the floor is yours.
Thank you, Dr. شعبان. بتشكر المنظمين اللي دعوني لأشارك بصياغة التقرير، تقرير المنتدى العربي للبيئة والتنمية 2020 والمشاركة بالمؤتمر 13 نيابة عن حالي وعن زميلي وصديقي ماي co-author بصياغة التقرير دكتور شرب العفيف من الجامعة اليسوعية. Air pollution perhaps is one of the world's most challenging environmental and health problems. And actually it was recognized as a pressing challenge, clearly figuring in at least 2 SDGs to complement what Dr. Habib has presented. Normally air pollutants, we look at them in 2 categories. What we call the criteria air pollutants, or the CAPs, which are actually the main determinants of the air that we breathe, the air quality, and the hazardous air pollutants, or what we also call the HAPs, which normally include the air toxics. And actually, many of the pollutants can be caused by natural processes, such as dust and sandstorms in GCC countries, مثل ما قالت Dr. Randa, and also sea spray in coastal areas, as in the case of Lebanon. But most importantly, air pollution is due to human activities from mobile sources such as traffic or point sources such as the stack of a factory or a power plant or an area source such as a landfill. ونحن بلبنان we have many or a volume source such as a highway or a conveyor. And this is actually only outdoors. Indoors also we have many sources that could impact air quality, particularly the combustion activities indoors, like cooking or heating, a cooling system, humidification devices, tobacco smoking, the building construction material, the furniture, and many chemicals that are used as part of the household. Now, the reports from the Arab world are actually alarming because they show a trend of increase in air pollution levels. And this is mainly attributed to rapid urbanization and economic growth. And in many parts where studies have been done all over the MENA region, studies show that the emissions of air pollutants have increased by up to 5-fold in certain areas in the past 3 decades. And this is mainly attributed to the energy sector and the transportation sector. According to the World Health Organization, the air quality indicators in the Arab countries often exceeds the guideline values. Now, so as part of the criteria air pollutants are the particulate matters, which are actually showing a trend that are in excess of the international standards. And this is based on reports by the WHO and the World Bank. The particulate matter 10, which is what we call the inhalable dust, which is normally the dust that comes from grinding and crushing and construction activities. If we compare the cutting point, the standard defined by WHO of 20 microgram per meter cube to the data coming from the Arab world in different Arab countries, we can see that there is an excess. It is in excess by 6 to 13 times. If we look at the data for PM 2.5, which is what we call the respirable dust, and this is the dust of the highest concern because this is the dust that actually enters our lungs, and it mostly comes from combustion activities. So if we compare the WHO standard of 10 microgram per meter cube to the levels in the different countries in UAE, Bahrain, Egypt, Iraq, Kuwait, Qatar, Saudi Arabia, again, we can see that it is in excess by 3 to 8 times. My slide is freezing, so. Okay, so again, in addition to the PM, there's actually a trend of increase over Arab urban centers for the other caps. So for instance, for SOx, which normally comes from fuel and power plant, normally there's an increase by 60 to 120%. And for NOx, which normally comes from traffic, and this is the pollutant responsible for the brown smog, there is also an increase by up to 12%, again, over urban centers in a report looking at data between 2005 and 2015. The levels are also high over oil ports and refineries and urban settlements in the GCC countries. And these actually increasing patterns that we're observing are actually attributed to fossil fuel addicted societies. and societies that are not really investing much in clean energy, the increase in population density, and the absence of eco-friendly public transportation systems in many Arab countries. Now, for hazardous air pollutants or the HAPs, we are also seeing trends of increase. For instance, for non-methane hydrocarbons, there is also an increase by up to 7% over Arab urban centers. In Beirut, for instance, there is actually an increase of non-methane hydrocarbons like benzene, for instance. And if you can see that it's much higher compared to larger metropolitan cities like Los Angeles and Paris. Now, the data from the indoor air pollution, based on the research studies that were conducted, are not much better because they also show levels that are in excess of the WHO air quality guideline values for different air pollutants like PM2.5, NOx, volatile organic compounds, ozone, and other pollutants, and this is in different settings in different countries. Now, these levels are alarming because there is mounting evidence that indicates that this exposure is actually associated with an increased health risk. The ambient particulate matter are reported as the 5th leading risk for DALIs in Eastern Mediterranean region countries, one DALI being defined as the loss of the equivalent of 1 year of full health due to a disability or due to a premature death. If you look at the data on the left, the highest reported DALIs lost per 1,000 capita per year for indoor air pollution is in Yemen with 13 DALIs, followed by Sudan. And this is mainly because of the use of solid fuel indoors. If you look at the highest DALIs lost for outdoor air pollution, and we can see that it is highest in UAE and followed by Lebanon. But at the same time, you can see that there are many large data gaps for many other countries and a large underreporting as well. Now, more specifically, exposure to these excessive levels of air pollutants are associated with a higher mortality rate in many countries. And there are many reports for Egypt, Kuwait, Lebanon, UAE, and others. For instance, in UAE, the leading environmental contributor to mortality is ambient air pollution, making 7% of all death. Similarly, in the city of Beirut, in a study that we conducted earlier, tracking PM2.5, we found that it is associated with about 7 to 10% of all death in the city on a yearly basis. Air pollution is also associated with cardiopulmonary diseases in many Arab states, and of course globally, like COPD, ischemic heart disease, hypertension, and asthma, which prevalence is increasing. There is a recent report that shows a 42% increase in respiratory diseases in the EMR region over a period of 15 years. Air pollution is also associated with higher cancer risk, and this is reported for a certain number of Arab states. There is a certain shortage of data on that, but there are still few reports that report that. And this is important because the International Agency for Research on Cancer, the IARC, has actually classified outdoor air pollution as in group 1 with sufficient evidence that it causes lung cancer in humans. Among these reports, we have previously reported a 30 to 40-fold excessive cancer risk due to non-methane hydrocarbons in the city of Beirut. There's another Lebanese study that reported a 13% of total lung cancer cases in Lebanon to be due to particulate matter. 100-fold higher cancer risk due to heavy metals and PM10 in Jeddah in Saudi Arabia, and there are many other reports. Of course, air pollution causes other diseases as well, some of which have been mentioned by the presenters before me. Air pollution can also cause other effects. We actually recently found that air pollution can contribute to birth defect risk based on a large-scale nationwide study that we are currently conducting in Lebanon. As a conclusion, air pollution levels in the Arab world are showing increasing patterns and alarming patterns, especially in urban centers. The observed trends are mainly due to fossil fuel burning, to road transportation, which mostly relies on passenger cars rather than public transportation, industrial activities, and that particularly include the oil and the gas sector. And all of these are, of course, topped with natural sources that I already mentioned. The challenges that are currently facing the Arab world towards improving their air quality includes outdated regulations, lack of law enforcement, and absence of sustainable air quality monitoring networks. At the health level, the data from the past 25 to 30 years report an increase, a tremendous increase in cardiopulmonary diseases and in cancer incidence. However, at the same time, there is a lot of data gaps in many countries, and this precludes an accurate assessment of the health impact. So I'd like to conclude with recommendations. وهون بدي اختم التوصيات بالعربي. دكتور صعب سمح لنا نحكي عربي، صح احكي بلغتنا الام. اول شيء تحديث القوانين والمراثيم التنفيذيه لفرض اعتماد افضل التقنيات، يعني البست افيلبل تكنولوجيز للحد من الانبعاثات السامه. ثاني شيء تطبيق القانون بطريقه فعاله وتغريم المؤسسات والصناعات اللي غير ملتزمه. ورقم 3 هو استدامه وصيانه شبكات المراقبه. هون عم بحكي عن مراقبه نوعيه الهواء، يعني الاير كواليتي مونيتورنج نتوركس، ونحن عندنا معاناه خاصه بلبنان بهذا الموضوع. والنقطه الثانيه هي استدامه كمان تقارير المؤشرات الصحيه. رقم 4 هو انشاء وتحديث قوائم مصادر الانبعاثات، يعني الاميشن انفنتوريز، واستخدام نماذج عاليه الجوده بموضوع محاكاه تلوث الهواء، يعني الاير ديسبرشن موديلنج سيستمز اللي هن they should meet scientific performance criteria. رقم 5 one of the gaps اللي بدي اذكرها هو الموضوع ال concentration response functions اللي هن missing in many of our countries. وهون هذا على عاتق الوزارات المعنيه انه بكل دوله يكون عندنا concentration response functions derived حتى نقدر نحدد الاثار الصحيه كباحثين بشكل ادق. ورقم 6 هو وضع قوائم تحدد الاولويات لتقييم المخاطر الصحيه، كمان هون من قبل الجهات الحكوميه كاساس لاداره المخاطر. وشكرا.
Okay. شكرا دكتور دهيني. Thank you very much. We still have around 10 minutes before we start the general question and answer session. I have one question for all three speakers. رح بلش معك دكتور دهيني بما انه انت بعدك على البوديوم. شو هن المين challenges اللي يعني or obstacles facing the successful combating of climate change in Arab countries in general or in one or two countries that you select?
I think the main I would say the main factor هو outdated regulatory يعني regulations, rules and regulations and policies. لأنه بكتير محلات we are still using very old text in regulatory issues. يعني recently I've been involved in with this regulating the cement industry emissions in Lebanon. وشفنا إنه في كتير very outdated يعني very outdated policies. The other issue which I think is very important هو the lack of law enforcement. The lack of law enforcement because of the deterioration in the structure of of the system, but also the what I think what Dr. Nouahed talked about, اللي هو in some places the political system which is not allowing a adequate compliance. I think these are the two major factors that are barriers to fighting climate change and air pollution at the same time.
يعني إذا في policies ما في law enforcement.
صح. يا واحدة غايبة والثانية موجودة أو بالعكس.
Dr. Ahmadi, you have anything to add? عاوز سمعت دكتور أحمدي.
I was just unmuting myself.
Okay.
I think in addition to my colleague, Dr. Hassan, what he said is he spoke about policy, but I want to speak about access to data as well. I think we have problem as researchers in having access to data because this data is collected by ministries, and it is very, very difficult because I know, I was involved in 2 reports, national reports for Bahrain. So I know the problems of facing getting the data, them understanding why you need all this and how the data should be. This is from, research, the data we need is not available. It is not online. It is, we cannot find it. We have to get permission all the time. I don't know about other countries, but in most of the countries, it is like that.
Or get it from EPA.
Yes,
from
yeah.
EPA or EIA.
So, lack of data, outdated data sometimes, or so I know about the policies, and the other problem is engagement of policymakers. Policymakers can be engaged in several ways, but with respect to climate change, I mean, in Arab countries, I haven't seen efforts to bring researchers and policymakers together. Maybe when if they meet together, they can, as a group, they can, policymakers understand our view.
Okay, thank you, Dr. Ahmadi. Dr. Jehan Hassan is not on screen.
Yeah, I am.
Yes, please. The story in Egypt.
I think both Dr. Dehini and Dr. Hamada touched on the most significant points. They leave very little to say, but I would like to say in general, I think the institutional framework needs modification, both regulatory, policy, laws. I think there's also, because of perhaps the absence of data, and in addition to that, there is lack of awareness and education on the issue in general. I think combating climate change, whether through adaptation or mitigation, requires a lot of stakeholders to be on board, to be aware of what's happening, for research to be conducted on the issue in the Arab region. I mean, there's a lot of research globally, and even globally, there are still a lot of challenges that are facing different countries. But I think we need to bring everyone on board. There needs to be transparency, and we need to have clear set plans, both nationally and collaboration regionally, in order to be able to face this. This would include investments in the sector, and particularly with mitigation. I mean, there's a lot of information, particularly published by the World Health Organization, that shows that I mean, even though there might be a large investment at the beginning, but you get this back, particularly when we look at health, and it's worth it. So there's still a lot to be done, I think.
Okay, thank you. في عندي سؤال من مس فادية محمد لدكتور رندا حميدي, asking how humidity is related to climate change and how it is becoming a major factor in Bahrain. Dr. Ahmadi.
Thank you for the question. Well, actually, Bahrain is a very humid country, and we have several months which are quite humid. The study that has been done is an ecological study which have shown that there is an association. And this was done during the third report for the UNFCCC. And we're planning to do publications from the report. But we have found several relationships between humidity and overall mortality, as well as specific diseases. So when one increases, the other one is increasing, which means there has been an when the decline. If there is a decline in humidity over the years, we have been noticing a decline. There was a decline in overall mortality in Bahrain. But it's not only Bahrain that reported it. It has been reported elsewhere. It's in the chapter.
Okay, thank you. I guess we can transfer the mic to you, Najib, if you want to open the general Q&A.
Yeah, I think you could have opened it. You are the master now, but now the coming 30 minutes, as you asked me to talk, because here in the control room, we are monitoring questions coming and trying to compile them. So for this session, we have some questions which were sent to you. And you can select. I hope you have seen them. Have you seen what you received? One.
I can't see them.
You should see them to the right side.
في عندي chat.
Yeah.
Only the chat.
So yeah, in the chat you have some questions, and one of them is for Dr. Rima Habib, if she is still there. If Dr. Habib is still there, tell us when you are there. If you cannot see them,
I go.
yeah.
Still there.
Still there, very good.
Do you want, Najib, do you want to take the questions of this session first? Because we had our share of questions before, and then we can continue.
Then yours will come later.
Yes.
If you cannot see it, Farid, then we shall ask them from here.
Yeah, because I can see this question إنه كمان يستغرق التعافي الحيوي لمنطقة الانفجار ببيروت.
Okay. This one was for Rima. There is one question specifically for Dr. Hamada.
She answered.
Yeah, and then.
Actually, we cannot see the questions in the Q&A.
Okay.
Can I suggest, Najib, that you ask questions in the control room?
Dr. Habib, if you
ask the questions from the control room.
If you answer the question, if you have seen it.
No, I did not see it. You need to ask the question.
بحسب توقعكم, because you talked about Beirut explosion.
Yes.
بحسب توقعكم ما هو الوقت الذي نحتاجه لمعالجة نتائج انفجار بيروت, للتعافي من انفجار بيروت?
You want me to answer in Arabic or in English?
In English or in Arabic, and I'll say the question in English. Somebody is asking Dr. Habib, because she talked about the explosion in Beirut, what is the time needed to recover from the consequences, the results of the Beirut explosion? I know, for example, I start with the answer. In our office and my home in Beirut, physically we recovered. We kept some things to remind us. let's say, broken curtains, we keep them to remember, but mentally and psychologically, I think it will need much longer time. But Dr. Habib.
Thank you, Najib. Thank you for introducing the answer for this question. I totally agree. If you want to start with the cost of the damages, it has been estimated that it needs about $8 billion to recuperate and to rebuild the damages. As you know, hospitals were destroyed, households, streets. It was an enormous destruction, an enormous blast that we are going to talk about the same way that probably the Bhopal incident that happened in India in 1984. We kept on talking about it until now. We're still seeing reports on BBC and everywhere on this. So I think that the blast of Beirut is going to be talked about for years and years to come, especially when we unravel the effects of the blast. This is in terms of cost and in terms of impact, as I was showing it in the presentation. Time to recuperate. How can I answer this question? Lebanon lacks the will, I think, to come together as people and as political parties and as government to do something about it, to help the people who are still, some of them living amongst the rubble and the demolitions. So how long it takes? It's the will and the determination of the system, of the government, of the agency. I know that there is agency amongst the people. They have started doing something. They have started working. There are many people that are sometimes establishing alliances and coalitions just to help the people. And we've heard that the army has already enlisted all the damages and the households that have been demolished. And they sent a WhatsApp message to everybody who has been affected. I received it, including me, because my glass was shattered in my home, that you will be compensated for the cost, but you need to keep the receipt. The people could not even afford, with the capital control that we had in the country, the banks were not giving people money to be able to rebuild and recuperate from the damages. So I think this time it's going to be a very, very long time to recuperate, because our political system has collapsed. We don't have a sound political system. We don't have the will and the power to do it. And I think they are only private initiatives that are working currently to help the people. And I'll stop there. Thank you.
Okay. Okay, now we have a question from Magali Mansour. And then it is, were you able to measure the effect of the materials that resulted from the Beirut explosion on the overall health of people in Lebanon? So this is related. So maybe Hassan maybe and Rima can answer us.
I'll say a few words and then I'll give the floors to others. No, the health impacts are yet to come. Of course, we had the number of deaths. So we have over 200 deaths, and these are the acute impacts of the explosions. We also had 6,500 injured reported, and these are also another acute impact of the exposure. With regard to the longer term effects, the more chronic, they won't show up instantly, but there are initiatives that will be starting soon to deal with this issue. And of course, the respiratory effect, we can detect them much earlier. such as COPD, asthma, triggers, and all of these things, the longer-term effects from the exposures to the dust, glass, chemicals are going to be a little bit longer term, and we will need to establish perhaps observational studies and longitudinal studies that will allow us to detect those effects. But efforts are underway. Thank you for the question, Magali.
It will be good if Dr. Hassan can have his intervention on this regarding the quality of air. It is one of the main effects of the explosion.
Sure. Yeah, I think I think the direct effects are the casualties, and in reference to what Dr. Habib has said, but still, we still don't have data on the long-term effects. Based on what we know about the material that has exploded, we estimate that there has been a release of toxic gases like NOx and particulate matter. The particulate matter are of the highest concern because they can suspend in air for a long time. There are also the hazardous material that there are reports about that actually have been evaporated in the explosion, and some of them are unaccounted for. And this is all in the rapid assessment that the World Bank has conducted. And there are also concerns about the asbestos in the silos, the wheat silos, and how it's going to be managed. So there are still issues, and we don't have yet enough data to report on the indirect effects. Concern that I would like to raise.
I combine two follow-ups which we received here. Is there any work which started at least to measure the changes in the quality of air on water, blah, blah, blah? I mean, is there any work which started? What can you say as a Faculty of Health Sciences in Beirut, in the city which had the explosion? Do you know of anything which started to measure the impact?
Okay. There are initiatives that have started already, and Khadat Beirut, for instance, that has been recently established as an alliance from AUB faculty and elsewhere, that is led by Dr. Najat Saliba and other faculty members and people from outside AUB. Are trying to establish, and there is the environmental health group, which is led by Dr. Iman Nouaihid, Professor Nouaihid, who are trying to establish, who are trying to collaborate with a French group, some US groups also, in order to make these measurements and assess the impacts on health. So the initiatives have started as a short answer, but it will take a little bit of time to materialize and to establish. Even a cohort study has been thought of to follow up the people who have been affected by this major blast. I can see that the blast is on everybody's mind because it has been really a huge occurrence that has shook the country. Thank you.
Dr. Najib? Dr. Najib?
Yes, listening.
Yeah, can I just tell something, related to, because they might ask other things, but I want to when we had the oil fires of Kuwait?
Yes.
Yeah, Marhaba Rima.
Hello.
They have done a retrospective cohort study. And yes. They have, and we're teaching this actually so they took all those who were in Kuwait because they are the ones who were living, everybody was exposed. And then they looked into the visits of these people for respiratory illnesses in health centers. And they took those who were in Kuwait previously, right? So because everybody was exposed. But in your case, you have those who were in Beirut, and those who were بالجبل or in another. So you can do something like that. I just couldn't but talk.
Thank you very much, Dr. Randa. Yes, we're thinking about a control group in Tripoli that was far from the explosion. We're thinking about several scenarios that will be possible. We're also thinking about a certain age group below 5 to check how they will develop, perhaps, what will be their school performance, their mental health, and etc. over time, going back to schooling. So we are thinking of several options, but we are yet to choose the best option that we can have. Even we're thinking about the registries of the neonatal registry that is available at AUB, and thinking how and looking at how things were before and then after the explosion. So you are right, and hopefully we can consult you at some point in time to tell us if our methodology is sound and give us your feedback. But thank you very much for this observation.
Dr. Najib, may I intervene just for a minute? I think there are initiatives that are being launched. The issue is, I want to go back to the important point raised by Dr. Randa, اللي هو lack of data. Okay. So at the level of air pollution, we have no data at all that relates to the impact on air quality. In my presentation, I talked about the issue of maintaining air quality monitoring networks. Unfortunately, in Lebanon, everyone knows, our network has stopped since July 2019 because it's not being maintained, the air quality monitoring network. And this is one of the issues. The other issue that Dr. Randa, which I second, which she raised, the lack of data, gaps in the data, lack of quality, data of quality, problems in accessing data. These are all important issues that the researchers are facing, and that are barriers to overcoming the problem of the air pollution and climate change and their health impact. And this is the Port of Beirut explosion is actually one illustration.
It seems that we have covered. Yeah.
نجيب في يسأل دكتور باسل يوسف سؤال is about the money.
Dr. Yusuf just had to leave. He informed us he had another meeting with WHO, so he just had to leave.
I was going to ask if the WHO will participate in the recovery process of Beirut.
I'm sure they will, and I think now they will have more support, as the United States will come back to WHO shortly. So both of you in this session for air quality and for climate change, you will get a boost shortly.
Okay.
Because President-elect Joe Biden announced before he was elected that if he succeeds, his first decision, day one, will be to get back to Paris Climate Agreement. So it is good news for all of us. Now, it seems that the questions which we had for the panel are all covered. We have two persons who asked to speak from the morning. We have Mr. Julien Letellier, in charge of socio-economic affairs of the Barcelona Convention Secretariat of UNEP Mediterranean Action Program. And Mr. Julien, we gave him the screen now, and he has intervention from the Mediterranean Action Program. Julien, are you with us? He can talk. Now he is with us, so he should join shortly. Julian, we are not hearing you and we cannot see your frame.
Najib, can you ask him to type?
No, we gave him access, so we can see on our screen that he has access,
Okay.
but he did not show up yet. Okay, we'll move to somebody else who wanted to also give an intervention. I mean, keep Julian when he shows up. Mr. Ammar Al-Musi from Algeria.
Yes.
Ammar, are you
Yes,
there? We gave you
Yes, I'm
access.
here.
فيك تحكي عربي كمان إذا بتحب، يا عربي يا إنجليزي. فيك تحط صورتك على طريقة.
ممكن نعطي فرصة للعربي يحط صوته أيضا.
ها؟
أوكي.
فينا نعطيك 3 دقائق عرف عن نفسك حتى توفر علينا التعريف وقلنا شو اللي بدك تقوله.
الدكتور عمار موسي عضو برلمان الجزائري وعضو لجنة المالية وعضو دائم في الجمعية البرلمانية للبحر الأبيض المتوسط بام. أتكلم اليوم باسم الجمعية البرلمانية للبحر الأبيض المتوسط. الكرام، السلام عليكم. يشرفني ويسعدني أن أنضم إليكم اليوم كممثل الجمعية البرلمانية للبحر الأبيض المتوسط. كما أود أن أشكر المنتدى العربي للبيئة والتنمية على استضافة هذا الحدث. موضوع هذا المنتدى لا سيما في ضوء الوضع الذي خلفته الأزمة مهم جدا، ولقد أظهر
We lost his voice.
يا أمير يهرمي تتمثل في نمو اقتصادي غير مسؤول يتجاهل الآثار البيئية، فليس فقط غير مستدام ولكنه يضر أيضا بحياة الإنسان. ولقد أظهر الوباء الحالي حقيقة مؤسفة في هذه، وتقدر منظمة الصحة العالمية أنه في عام 2020 سيموت أكثر من 676 ألف شخص في منطقة الشرق الأوسط وشمال إفريقيا قبل الأوان بسبب التعرض للمخاطر البيئية التقليدية، بما في ذلك تلوث الهواء وعدم الحصول على المياه النظيفة والتعرض للنفايات والمواد الكيميائية الضارة كما سبق وذكر الزملاء. إضافة إلى ذلك أثبتت الأدلة العلمية أن المناطق ذات التركيز العالي للجسيمات الدقيقة المنبعثة من احتراق الوقود الأحفوري as NOx and SOx كما ذكر الزملاء سابقا ستكون أكثر عرضة وفتكا لفيروس كوفيد-19. الزملاء الكرام، هذه الأرقام تتحدث عن نفسها. اليوم تعتبر معالجة الآثار الصحية السلبية المرتبطة بالإدارة المتهورة للموارد الطبيعية ذات أهمية قصوى خاصة في بلداننا العربية، ويتطلب تعزيز الصحة والازدهار في منطقتنا التزاما قويا من صانع سياسة التنمية المستدامة وأهداف خطة الأمم المتحدة لعام 2030. وقد يوفر هذا التباطؤ الاقتصادي الناجم عن الوباء لحكوماتنا فرصة غير متوقعة لإعادة التفكير في كيفية مواجهة تحديات الصحة والبيئة والنمو الاقتصادي. تفشل التدابير التي تركز حصريا على التخفيف من الآثار الاقتصادية والصحية لكوفيد 19. ستفشل في دفع التغييرات المنهجية المطلوبة لأن التدابير يجب أن تكون شاملة. يجب على البرلمانيين والوزارات أو الوزراء في جميع أنحاء المنطقة العربية توسيع قدراتهم لتحسين الوصول إلى خدمات الصحة والصرف الصحي مع تعزيز السياسات التي تسهل الانتقال نحو نماذج التنمية الخضراء والمستدامة. من هذه الجهود تعمل الجمعية البرلمانية بشكل مستمر مع صانع السياسات من دول البحر الأبيض المتوسط والخليج من خلال تطبيق منهج ذو اتجاهين اثنين. أولا، تتعاون الجمعية مع منظمة الصحة العالمية البرلمانيين على الاطلاع بأحدث المعلومات المتعلقة بتطوير الوباء واللقاحات كما تسهل الجمعية البرلمانية بناء القدرات في أنظمة الرعاية الصحية، وتشجع الدول الأعضاء للانضمام إلى برنامج كوفاكس، والذي سيضمن الوصول العادل والمنصف إلى لقاحات كوفيد-19. من ناحية أخرى تلتزم الجمعية البرلمانية بالدعوة لتطوير الأنظمة الاقتصادية التي تعطي الأولوية للاستخدام المسؤول للموارد البيئية، ولهذه الجهود نعمل في مؤتمرنا هذا على تعزيز الإصلاحات التشريعية لصالح الشركات منخفضة الكربون والأنظمة الإنتاجية المستدامة في منطقة البحر الأبيض المتوسط والخليج. على ذلك بشراكة مع اتفاقية الأمم المتحدة الإطار بشأن تغير المناخ، تدعم الجمعية البرلمانية الدول الأعضاء في تقديم مساهماتها المحددة وطنيا على النحو المنصوص عليه في المادة الرابعة من اتفاقية باريس. سيداتي وسادتي، في العقود القادمة ستصبح قضايا الصحة والبيئة أكثر تشابكا، وستكون الإدارة والتسيير المسؤول للموارد أكثر ضرورة، وسيتعين إعطاء الأولوية للسياسات الاقتصادية التي تزيد من الاستدامة. لا يمكننا أن نفقد الفرصة الحالية لإعادة تشكيل مسار تنميتنا. إذا أردنا بناء مجتمع قادر على الصمود، يجب أن تصبح صحة الناس والبيئة الركيزة الأساسية لمشاريعنا لما بعد جائحة كوفيد-19. وشكرا جزيلا على حسن الإصغاء، وشكرا جزيلا لكل المتدخلين الذين أفادونا في هذه الصبيحة في هذه الندوة الشيقة، وبارك الله فيكم. السلام عليكم.
شكرا. بالفعل بدي شير انه في مشاركين متعددين من الجمعية البرلمانية للبحر المتوسط، خاصة من دول المغاربية العربية، وهذا شيء مشجع انه البرلمانيين العرب عم يهتموا بهالموضوع. I say it in English for Julian who joined us now. I already introduced you, Julian, you were not there. So I was saying that the speaker we had talking Arabic is Dr. Ammar Moussi, member of the Algerian parliament and of the Parliamentary Assembly of the Mediterranean. So he joins you in the Mediterranean. Now again to Julian, he will have 3 minutes to talk about their view at the Mediterranean Action Plan of UNEP, the Barcelona Convention. Julian would have liked to see you in Beirut again, but it is good that we can meet like this. Let's make sure that we hear you when you talk.
Okay. Do you hear me, Dr. Najib, now? Oh, perfect. So thank you very much. Thank you very much for inviting us to this launch event and very interesting discussion. I want first to express my strong solidarity with Lebanese people and with Beirut in those very difficult times. I am speaking on behalf of the United Nations Environment Programme Mediterranean Action Plan, UNEP-MAP. In a few words, the UNEP-MAP Barcelona Convention system is a UN treaty, a regional multilateral environment agreement signed more than 4 decades ago by the coastal state of the Mediterranean and the European Union. Our goal is to protect the marine and coastal environment of the Mediterranean as a contribution to the sustainable development of the entire Mediterranean region. And we are very pleased to count AFED as an official member of the Mediterranean Commission on Sustainable Development, which is the multi-stakeholder advisory body of the parties to the Barcelona Convention, gathering not only government representatives, but also stakeholders from various categories, including parliamentarians. And we are also very proud to count the Parliamentary Assembly of the Mediterranean as UNEP partners and MCSD member. I am pleased to inform you that the English version of the State of the Environment and Development in the Mediterranean full report is now available online. The summary for decision maker and key messages publication are also available in English and French as UNEP publication. I will share with you the website to find those publications. Let me mention that the preparation of the SOED was developed over 2 years with contributions from more than 100 authors coming from all Mediterranean countries. SOED covers a wide scope of issues from demographic trends and human development to biodiversity decline, pollution, and climate change. It also includes, for the first time, a full chapter on the links between human health and environmental degradation. Just a figure, 15% of deaths in the Mediterranean are attributable to preventable environmental factors. The sea is polluted by an estimated 730 tons of plastic waste every day, and the region is warming 20% faster than the global average. Although its preparation ended before the COVID-19 pandemic struck, SOED provides insights that are valid for informed policymaking in a post-COVID setting as a wake-up call. We aim at a green renaissance to lift the entire region, not just from the economic contraction caused by the pandemic, but also from the triple crisis of pollution, nature loss, and climate change. SOED provides the knowledge needed so that decision makers can take the right choices to enact the required changes. This is possible with strong political leadership and the participation of all stakeholders, including the private sectors, financial institutions, local authorities, civil society organizations, and informed citizens. The windows of opportunity is still open, and multilateralism and solidarity must prevail. Thank you very much.
Well, Julian, now we still have. Oh, good. Now we can see you, Mr. Musi. شايفينك حاليا. كان لازم تحط الصورة من البداية. مش عم نسمعك. حاليا فيها نسمعك. إيه. يبدو انه الكونكشن مش جيدة، فالدكتور عمار قادر يحط يا صورة يا صوت. حسب تجربتي انا لما نعمل اجتماعات يونب خاصة من دون صورة الناس بتنعس، افضل يكون في صورة. I was saying, Julian, that out of our experience, when you have group meetings like this online without an image, people get bored. And most of unit meetings in which I participate don't have images. So you don't know what the one facing you is doing.
ممكن تسمعني الآن؟
Yeah, no, it's هلا جيد. دكتور موسي حاليا شايفين صورته وصوته جيد. هلا أهلا. I just say, do you still have anything to say in this session, or we can close our day?
Is it for me?
عم بقدر اسمعك بس صورتك راحت رجعت.
مشكلة ما ادري يعني سيستم يعني.
نشكر مشاركتك جدا.
والزملاء هو العمل السيد نجيب هو العمل على مستوى البرلمانات من اجل موائمة التشريعات المحلية مع القوانين الدولية، يعني خاصة فيما يخص تشريعات حماية البيئة. هذا العمل يعني نعمل عليه يعني على مستوى الفام، يعني بالتنسيق مع برلمانات ومنطقة المينا كذلك. وطبعا مشروع يعني كوفاكس مهم جدا كذلك حتى يسمح للجميع الوصول آمن وللجميع يعني بأبسط الأسعار وأرخص الأسعار للجميع إن شاء الله. شكرا سيد نجيب.
لا أنا بدي أعلق أول شيء تعليق صغير بالعربي حتى يوصل للدكتور موسي، هو أنه نحن كثير كنا مسرورين أنه برلمانيين يشاركوا بهالاجتماع، لأن مهما تكلمنا بالنتيجة التغيير بصير من خلال القوانين والتشريعات. يعني لن نصل إلى مكان لو تكلمنا 100 سنة من دون قوانين وتشريعات. I'll say this in English also for Julian to understand what we're saying. I say we were very happy that parliamentarians, people from parliaments in the Arab region are participating in our conference, like Dr. Musi, because if we keep talking for 100 years, we won't reach anywhere without having legislation and laws which impose what we are saying. فشكرا جزيلا على مشاركتك، وبيكون لنا اتصال بالمستقبل أكيد. بفتكر إنه يومنا انتهى بسلام من أماكن متعددة من العالم كان معنا. ما عندنا أشياء إضافية بالفعل، ففيكم تراجعوا كل الجلسات على أونلاين، كلها تم تسجيلها. نحن اليوم انتهينا. غدا صباحا بنبلش الساعة 9 كمان بتوقيت بيروت، وغدا عنا جلستين بالفعل. الجلسة الثالثة وهي الأولى غدا رح تكون عن المياه والبحار، رح يديرها الدكتور وليد زباري من البحرين. والجلسة الرابعة يعني الثانية بكرة رح تكون عن الويست مانجمنت اند هيلث، يعني إدارة النفايات الصلبة وعلاقتها بالصحة. Saying it in English again, that tomorrow we start at 9 Beirut time. We have 2 sessions. One session is on water and marine environment and their impact on health. And the fourth session, which is the second one of tomorrow, will be on waste management, solid waste management and health. In that session also, we shall be having as guest speaker Dr. Leila Iskandar, who is very active in Egypt. She was Minister of Environment, and she was the one behind what you all know about Hayy Zabbalin neighborhood in Cairo, where she tried to involve local community in solid waste management. So tomorrow then we start at 9 Beirut time, 8 your time, Julian, I think, and 10 time of the Gulf countries and many other Arab countries, but it is earlier in the Maghreb countries, so even earlier than Europe. So for Dr. Ammar and others in Morocco and Tunisia and Algeria, they will have to wake up earlier than us in Beirut even to join. Thanks a lot. شكرا جزيلا.
There is a message from Saeed Zarkali on the chat. أطلب التدخل إن كان ممكنا. I'm reading it right now.
قلنا له لسعيد بكرة غدا.
Okay.
جاوبنا إنه غدا. يلا شكرا جزيلا. تحيات.